Hi everyone. We're going to start off with the rapid review of bacteriology, which is definitely going to be a little extensive because we have so many innumerable bacteria that we have to focus on. But my basic concern over here is how to make things concise. So I've not got you pages and pages of details of bacteria that you have to know. I've tried to make it very short. I've tried to bring collage based images so that everything is onto one slide, your toxins, your images, so that things become a little easier to can get it over at one place, and you're able to recall it also. You're able to memorize it and remember it on the day of the exam. On that note, let's begin with bacteriology. We'll start off with the basic rule, and we all know that all the cocci. Now, what are the rules, guys? All the cocci are what? All the cocci are said to be gram positive, and all the bacilli are said to be gram negative, right? However, there are exceptions. When I say all cocci are gram positive, except there is a mnemonic that is venom. And what is venom meaning? N stands for Neisseria, which you have over here, VE for Velonella, and M for Moraxella. So remember, Neisseria, Velonella and Moraxella, these are exceptions because these become the gram negative cocci. Next, I told you all the bacilli are going to be gram negative. So gram negative bacilli is the usual thing. However, there is a mnemonic called McDonald's, and these are going to be the gram positive bacilli. What is McDonald's? M for what is in our country very, very famous, M for Mycobacteria, very important. Now the next A and C. See, I always tell you when you learn a mnemonic over here, try to make some story, otherwise ABCD is all going to get messed up in the paper. So remember, A and C belong to the same family, and what is that? Anthracis or Bacillus anthrax and Clostridium. I hope you remember these are the spore forming organisms. Then you pick up the D from here and the D from here. Diphtheria and diphtheroids. Simple. The diphtheria and diphtheroids. So Corynebacterium, diphtheria and diphtheroids also come here. Then pick up the next family that you have. We have N and A, Nocardia and Actinomyces. Nocardia and Actinomyces, how are they one family? Because they are the gram positive filamentous organisms. And finally, we have something called as Listeria. So simple, guys. What is McDonald's? Mycobacterium, anthrax and Clostridium, diphtheria along with diphtheroids. Then we have Nocardia and Actinomyces, and finally we have Listeria. These are all gram positive bacilli. So let me get back. I'm going to start one by one in the family. All the cocci are gram positive, right? So let me start with the gram positive cocci only. And under the gram positive cocci, what are the things that I shall be discussing? The very, very famous to begin with is Staphylococcus aureus, or just Staphylococcus. Then I'll go on to the next family, that is Streptococcus, broadly. But Staphylococcus is a part of which family? Staphylococcus is a part of a family called Micrococcaceae. There is a family called Micrococcaceae which has two things, of course. One of them is Micrococcus and the other one is Staphylococcus. What are the differences? One table, let's make it concise. The word staphyle means bunch of grapes. So Staphylococcus is going to look like a bunch of grapes, whereas micro is very micro. It's just going to be clusters of 4. So they are said to be tetrads. Then if you notice, micro has all the O's in it. So if I say who is oxidase positive, then Micrococcus is oxidase positive and Staphylococcus is going to be oxidase negative. Similarly, how are they utilizing the glucose? Oxidative manner, fermentative manner. So you'll say again, ma'am, Micrococcus has all the O's. So oxidative manner utilization will be by Micrococcus, and Staphylococcus has the F wala sound. So fermentative pattern is going to be seen by Staphylococcus. Simple. Fermentative, simple guys, fermentative in Staphylococcus and oxidative in Micrococcus. Oxidase positive, Micrococcus, because catalase is going to be positive in both. Both of them are catalase positive organisms. So the Micrococcaceae family ka table is done. I'm going to start off with the Staphylococcus aureus in detail. If I ask you number 1, what are the virulence factors for Staph aureus that you have? Yes, what are the virulence factors? Number 1, we have protein A. Protein A has everything to do with A. It has 3 properties of A that we have. It is going to be anti-complementary, means it will not let my complement system work. It is anti-phagocytic, means it will not let my phagocytosis work. And it is responsible for a test called coagglutination. So protein A, anti-phagocytic, anti-complementary, coagglutination. Number 2, what are the enzymes that Staphylococcus has? You learn it by a mnemonic Staphylococcus. Can you fill in the blanks for me? So the T over here stands for thermonuclease. The T stands for thermonuclease, and because you have nuclease, you will also write DNAs along with it. The pH over here is going to be for phosphatase. The pH is going to be phosphatase. And finally, the C and C that you have are going to be catalase and coagulase. So these are the 4 enzymes that it produces: thermonuclease and DNase, phosphatase, catalase, coagulase. Virulence factor, protein A done, enzymes done. Let's go on to the toxins. The third virulence factor for Staph aureus are the toxins. Let us start. We have hemolysins, will break blood. Alpha, beta, gamma and delta hemolysins are there. Please note, beta hemolysin or hemolysin is known as the sphingomyelinase, and this is tending to show a very famous phenomena called the hot-cold phenomenon. Yes, you might not be asked the details of it, but definitely this word is asked, right? It's a sphingomyelinase. Basically, it breaks sphingomyelin and it is going to have a hot-cold phenomena. These are the 4 hemolysins that it has. Next toxin. Toxin number A was hemolysin. Next is PV, panten-valentine toxin. What are the 2 points about it that you have to know? This is associated with all the methicillin, not all, but majority of the methicillin-resistant Staph aureus tend to show you the panten-valentine toxin, and this is also known as the synergohymenotropic toxin. The synergohymenotropic toxin. Now, what do you mean by this toxin? There are 2 things which can act as synergohymenotropic. Synergo means they're going to work in two parts. The synergy. Synergy means synchronization. So, what are those? The PV toxin that I'm picking up from here, and which hemolysin or hemolysin can also be a synergohymenotropic toxin. That is the gamma. So, you remember how had we learned it? We wrote PV and then we also said that gamma looks very similar to the V. So which are the 2 synergohymenotropic toxins? We have the panten-valentine and the gamma hemolysin. These are going to be the ones which are synergohymenotropic. Coming to the third one, which is very obvious, epidermolytic or exfoliative toxin. Of course, it is going to result in epidermolysis, right? So that basically means that there is SSSS, staphylococcal scalded skin syndrome. It is also associated, the same staphylococcal scalded skin syndrome in children is known as the Ritter syndrome. It is known as the Ritter syndrome. It is associated with another disease in the skin called toxic epidermal necrolysis. All of these you have studied in your dermatology, isn't it? So the word is only telling me the skin is going to come off, peel off, epidermolytic exfoliation. So staphylococcal scalded skin syndrome, Ritter's and toxic epidermal necrolysis. The third toxin is over. Now we go on to the 4th toxin, and that is common sense, which I've put it up as enterotoxin F. So you will say, ma'am, why enterotoxin F? Does that mean that there are some other enterotoxins also? Exactly. So I'll bring up both of them simultaneously. When I'm talking about enterotoxins, first I'll talk about entero matlab kuch ma'am GIT related, food poisoning related. Yes. First I have enterotoxins A to I, but no F. No F. Not F, only A to I, and they are definitely responsible for entero, means they are responsible for food poisoning. What is the incubation period of this food poisoning? It is less than 6 hours. So we are now going to make a very, very interesting table out here, and all of you will be telling me what are the 2 main food poisonings that we have where the incubation period is less than 6 hours. One of them is going to be Staph aureus and the other one is going to be Bacillus cereus, right? Staph aureus and Bacillus cereus, both of them are because of incubation period less than 6 hours. So how do I differentiate? C for C. Bacillus cereus is because of consumption of Chinese fried rice. So remember C for C. And Staph aureus is because of consumption of meat and milk. So poultry, meat, right? Meat and milk consumption results in Staph aureus wala food poisoning. C for C, Chinese fried rice consumption results in Bacillus cereus. However, you must be knowing what kind of food poisoning is it? This is the vomiting wala food poisoning, emetic. This is not the diarrheal food poisoning that I'm talking about. So why is there vomiting that has happened? So remember, there is stimulation of the vagus. There is a vagomimetic action that both of these things do. There is a vagomimetic action and thus the patient has vomiting. All except enterotoxin F, because enterotoxin F, F for female, F for fatal, that is your methodology of learning it. F for female, F for fatal. What fatal disease am I talking about? Toxic shock syndrome. So enterotoxin F doesn't cause food poisoning. Enterotoxin F causes a fatal disease called toxic shock syndrome, which is because of use of, why did I say females? Because in females, if there is a prolonged usage of tampons, that is when toxic shock syndrome occurs. So what kind of a toxin is enterotoxin F? Why is it causing such a deadly disease? This is a super antigen. So remember, all enterotoxins are going to cause entero food poisoning, but enterotoxin F causes toxic shock syndrome associated with tampons. All of that has finished off the virulence factors. Starting once again, we have protein A, then we have all the enzymes, then we have the toxins. Toxins may hemolysin, pantin, valentine. You combine pantin, valentine and gamma, that becomes synergohymenotropic. Epidermolytic for things to do with skin, entero to do with food poisoning, all but F to do with fatal toxic shock syndrome. What are the clinical features that Staphylococcus aureus has? We learn it by soft pains. What is soft pains? Let's begin. First, all the skin and soft tissue infections that we have are going to come up under it. So one of the very famous skin and soft tissue infections that it causes is botryomycosis. Now again, whenever I say mycosis, it looks like a fungal infection, but is not a fungal infection. Botryo word means it's looking like a bunch of grapes. Botryo means bunch of grapes, and botryomycosis is caused by bunch of grapes jaisa hai, matlab it's going to be caused by the organism that looks like a bunch of grapes, and that is Staph aureus. Coming back, so skin and soft tissue infections. Number O for bone, guys. Osteomyelitis, of course, most common cause of osteomyelitis is going to be Staphylococcus aureus. Then I've told you F for food poisoning. Come on, we already know this. Food poisoning, incubation period less than 6 hours. We've done this. The T also we've done. We've done the very fatal toxic shock syndrome, and in the skin we have done the toxic epidermal necrolysis. Then think about the lungs, pneumonia, pneumatocele. All pneumonia, pneumatocele. In fact, if they ask you the most common cause of hospital-acquired pneumonia, ventilator-acquired pneumonia, Staph aureus is something that is coming to your rescue. Coming to the next, soft pains. A for, again, you have read about this. It is acute endocarditis, infective endocarditis. They ask you most common cause of acute endocarditis, or they ask you the most common cause of native valve, not prosthetic, but native valve and acute endocarditis. It is going to be Staph aureus. Another infection, because we are now talking about infective arthritis. Yes. And finally, what do we have? We have N for necrotizing fasciitis and S for sepsis. So please note soft pains. Jaldi 10-second recap. Soft tissue infections, along with that necrotizing fasciitis and sepsis. Osteomyelitis, food poisoning, TSS 10, pneumonia, pneumatocele, acute endocarditis, infective arthritis. That makes it soft pains, and you're done with the clinical features. Now I can show you the collage of how to do the diagnosis. Come on, guys. You know it is a gram-positive organism. I can see the ... gram-positive cocci like a bunch of grapes. That is the classical description that Staphylococcus aureus has, right? Why did we call it aureus? Because AU matlab gold. AU is the chemical formula of gold. So if I see that what has it grown on a nutrient agar, so I will notice that it has grown a golden color pigment. Golden pigment, and please note this pigment is non-diffusible. It has not diffused out. It is a non-diffusible pigment. That is why it's golden. And what is the reason for it being golden? Composition. It is made up of beta carotene. Naam kya hai? Staphyloxanthine. Xanthine tells me something to do with beta carotene. Staphylo tells me Staph aureus. So staphyloxanthine is the one that is going to give it a golden color. Finally, coming to the blood agar. In the blood agar, I see that it has a very narrow zone of hemolysis. Hemolysis hai, but little hemolysis is occurring. So remember, it shows you a narrow zone of hemolysis. That is your blood picture that you have. Remember, grape-like, nutrient agar, golden color, blood agar, narrow hemolysis. Finally, what is the selective media? That is going to be mannitol. What did I say? Selective media. So you want to say only selective media? No. When I say MSA, MSA stands for mannitol salt agar. So it's quite a spectrum. Firstly, when I say mannitol, mannitol will tell me that it's telling me whether there is mannitol fermentation seen or not. This means it's telling me a difference. It's a differential media. Salt. Salt is something which Staph aureus can grow. So remember, Staph aureus requires salt to grow. That is why I'm calling it a selective media. And finally, because I'm talking about a color change, I'll give you an example. See, If you're talking about mannitol fermentation, when mannitol has been fermented by Staph aureus, I'm getting a yellow color. So am I getting a color change? Why? Because I have used an indicator. The name of that indicator is phenol red. Previous year question. What is the indicator that you have in mannitol salt agar? So that is why it's all red, red, red. Only when the color will change, when mannitol will be fermented, the color will become yellow. So simple, mannitol for differential, salt for selective, and the indicator used is phenol red. Is Staph aureus going to be a mannitol fermenter? Yes, I can see that. Perfect. Should we go on to the biochemical test? All the cultures are done. Biochemical test. What is this test, guys? Where you get to see a lot of bubbles, bubbly test. So the bubbly test is always catalase, right? So remember, the bubbly test is catalase. How I have learnt it is a mnemonic. Now, I'm sure you want to know that what are all the catalase positive organisms. Firstly, you've understood that if I have to catch a catalase enzyme, I should see a lot of bubbles in it. I can see the bubbly test. Cats are very bubbly. They will never sit at one place. You need a lot of space. So what is it? Space being made for the cats. For the bubbly cats, space is being made. So please note, S is going to be S and P. How have I learnt it? Ek ek karke aayenge. Club organisms like S and P are all the pigmented organisms that we have in bacteriology. S is for Staphylococcus aureus. Guys, what is the color of Staphylococcus aureus? What pigment? Golden color. S is also for Serratia. Serratia gives you what color? It gives you red color. Then P for Pseudomonas. Pseudomonas gives what color? Blue-green color. So remember, there are these two, S and P. Space. So if I write the mnemonic on one side, it is space being made for whom? For the bubbly cats. Space is being made for the bubbly cat. So for the bubbly catalase positive, S for Staphylococcus aureus, Serratia and Pseudomonas. A and C are for the fungal organisms. That is, we have Aspergillus, Candida and Cryptococcus, right? Aspergillus, Candida, Cryptococcus. Coming to the E, the entire Enterobacteriaceae E. coli wala family. The entire E is Enterobacteriaceae E. coli. So space ho gaya. Now let's come to B and NG. What is B and NG? B stands for Bacillus anthracis. That is very, very famous. So B, it's quite deadly and you will see it's important for you to know B for Bacillus anthracis. And NG for not only, now many people believe only Neisseria gonorrhoeae, but all Neisseria, even Neisseria meningitidis is catalase positive. So space being ho gaya, and finally made. M for, in our country you can't forget TB, na? So M is going to be for Mycobacterium TB and M is also going to be for Micrococcus. So finally I say space being made for the bubbly cats is the mnemonic for catalase positive and Staph aureus is definitely under it. Now tell me, other than catalase, there was one more test that Staph aureus was showing you, and that was the coagulase test. So firstly, guys, how do you know what are the different types of coagulase tests that we have? We have a slide coagulase and a tube coagulase. Okay, I can see in the bottom there is a test which is done on a slide and there's a test over here done on a tube, right? So one is slide, one is tube, and what are their other names? How many alphabets does slide have? 1, 2, 3, 4, 5. So it is also known as 1, 2, 3, 4, 5 bound coagulase. Okay? How many alphabets with tube? 1, 2, 3, 4. That is known as 1, 2, 3, 4 free coagulase. So 5 alphabets together, 4 alphabets together. Slide is known as bound coagulase. Tube is known as free coagulase. What are the organisms going to show you these? I realize Staph aureus shows you both. Staph intermedius also shows you both, and Staph hycus also shows you both. So sab mein answer both. But Staph schliefferi, Ferry has the word free in it. Schliefferi or Schlieffri, that only shows you the free coagulase. Whereas Staph lugdunensis sounds like dunensis, sounds like bound. So that is going to show you the bound coagulase only. Easy. Schliefferi only shows you free coagulase. Lugdunensis only shows you bound coagulase. One thing, for these reactions to occur, we need some important chemicals. Please note that for the slide, the one that is bound, a bound ke liye, it is also known as the clumping factor. We need clumping factor. And when we come to the tube coagulase wala, we need something called the coagulase reacting factor or CRF. So now you'll get confused where is clumping and where is coagulase reacting factor. So simply remember that clump. When I talk about a clump, it is going to be something that is bound clump hota hai, right? So bound coagulase is the one responsible or having a clumping factor. That is your mnemonic for the entire coagulase. All your Staph aureus features are done. We also need to touch upon the treatment, guys. What is the treatment for Staphylococcus aureus? It is going to be penicillin, that is nothing but beta-lactams. How does the beta-lactam act in the body on a bacteria? So if you all remember, this was the structure of a bacteria that I have over here, and all the bacteria has certain things called transpeptidases. What are transpeptidases? PBP, penicillin binding protein. So remember, everywhere in a bacteria, in a Staph aureus, there is a penicillin binding protein called transpeptidases. Beta-lactam will say, I will go and break this transpeptidase, and if I can break it, the bacteria is going to die off. Simple. So that is the mechanism of action of beta-lactam, is bind to penicillin binding protein, transpeptidases, break it off. However, there is going to be resistance. Bacteria says, I am smarter. I am going to make something known as beta-lactamase. Bacteria says, what is the bacteria making? Bacteria says, I am making beta-lactamase. I will kill this penicillin before the penicillin can kill me. That is what the bacteria is doing. How does it make beta-lactamase? By which gene? By the BLA gene. How is it transmitted? How is it coded? It is plasmid coded. The resistance is by BLA, beta-lactamase production, which is by the BLA gene, which is by the PLA coded. BLA. And how is the plasmid? If one bacteria is resistant, how will he transfer it to another bacteria? Staph to staph transfer kaise hoga? So remember, there are two methods: transduction and conjugation. Listen to me very carefully. You've done this in your general micro also. All the resistances are transferred by conjugation most commonly. But for Staph aureus, the most common mode is transduction, and that is a very famous question. The transfer of resistance by transduction, more common than conjugation. Okay, so now tell me, if someone is penicillin resistant, what are you going to use now? Now we'll start using methicillin. But can methicillin also be resistant? Yes, methicillin resistance is also known, and that is due to which gene? That is due to the MEK-A gene. What actually happens? You will say, ma'am, that binding site only changes. You told me that the bacteria will be having a PBP. Over there, the antibiotic will act. But what happens is, because of this MEK-A gene, the penicillin binding site is going to change to penicillin binding protein 2A, PBP2A, and this has a lesser affinity. This will not let the antibiotic come and bind to it. So now you will say, how does my methicillin act? Simple. So methicillin resistance, ME, is because of the MEK-A gene resistance, and what happens in it? PBP is basically going to convert into PBP2A. How do I do the diagnosis? There is a disc diffusion method which is very famous, called the cefoxitin or oxacillin disc diffusion method. That is how you find out whether someone or bacteria is resistant or sensitive to methicillin. So now remember, out of cefoxitin and oxacillin, if asked, cefoxitin is better, is more important as a methodology for testing for methicillin resistance. However, now we've got कि directly ये देख लो ना, do you have PBP2A, do you have MEK-A gene? So directly find this out in the bacteria. For that, you can do latex agglutination, ELISA, and PCR. These are the more advanced testings you have for finding out the different types of resistances. So next question, when penicillin was resistant, you gave methicillin. Now if I say that methicillin has come out to be resistant, what are you going to give? Methicillin resistance mein we can give vancomycin or daptomycin. Now also knowing, guys, is there a vancomycin resistance known? Yes, even vancomycin resistance has now been implicated. We have two types of situations: vancomycin intermediate Staph aureus, which is kind of resistant, vancomycin intermediate, and one is vancomycin resistant Staph aureus, which is definitely resistant, right? And this, please, the diagnosis of vancomycin resistant Staph aureus is made when we need at least 16 microgram per ml of vancomycin. Minimum inhibitory concentration, imagine, that's not at least, 16 is a lot. When you need 16 microgram of vancomycin at least to inhibit Staph aureus, this means it's a very high dose. This has gone resistant. Whereas what is the diagnosis of vancomycin intermediate Staph aureus? When it is between 4 to 8 microgram per ml as the minimum inhibitory concentration. What does that mean? If you need 4 to 8 microgram, this means abhi kind of susceptible, kind of resistant, intermediate amount. But if you've started requiring 16 microgram per ml of vancomycin, then that becomes vancomycin resistant Staph aureus. So starting off as a quick summary, pehle do penicillin. If penicillin is resistant, you give methicillin. If methicillin is resistant, you give vancomycin. If that is also resistant, then you'll have to decide as per antibiotic sensitivity what you have to give. Now finally, all of this was about Staph aureus, because now I'm going to start off with another family which is also staph, but it's a different kind of a staph. It is cons. Cons matlab it is going to be a coagulase negative staph. It is a kind of a coagulase negative staph, and that is what we call as cons. What are these? Staph epidermidis and staph saprophyticus. Staph epidermidis is very common, very important. Why? Because it causes what? Something in the heart. Prosthetic heart valve endocarditis is what it causes. Whereas saprophyticus kya karta hai? It causes UTI. Out of these, which of this is novobiocin sensitive? It is the epidermidis is sensitive. However, it is very famous for one thing. It causes a biofilm production. So biofilm production is also going to make it resistance to antibiotics. Resistant to the antibiotics is what is going to be needed, or what is going to be seen over here. So you will say, ma'am, thoda contradictory hai. Is it sensitive to novobiocin? Yes, it is. But if it produces a biofilm, then it can become resistant to antibiotics. So biofilm production will not be seen all the time. Okay? So simple. It is usually sensitive to the novobiocin. But if a biofilm production occurs, then it's not going to be sensitive. Then it's going to be resistant to any antibiotic. Okay, so these were the two things. Remember, epidermidis causes prosthetic heart valve endocarditis. Saprophyticus causes UTI. Both of these are their respective PYQs that you have to know. That wraps up your Staphylococcus. What is the next coccus that you're going to start with? You shall start with the Streptococcaceae family, which is classified on the basis of the hemolysis. Alpha hemolysis, beta hemolysis, gamma hemolysis. Directly, let us do that with the help of diagram. When I say alpha hemolysis, the way I write alpha, I can fit a G into it. We are going to get a green color, and you can see the greenish color made over here. When we talk about beta hemolysis, you can make a Y out of it, because I can definitely see a yellow color coming out of it. Yes, I can see a yellow color here. And when I say gamma hemolysis, this is basically no hemolysis that has happened. So now these are the things that I have to study. Let me start one by one. If I ask you guys, what are the things that come under alpha hemolysis? V and P, that is Streptococcus VP, Streptococcus viridans and Streptococcus pneumoniae. What comes under gamma hemolysis? It is just one thing that is known as Enterococcus. And then what comes under beta hemolysis is different, because this has a full classification. Can you tell me, for the beta hemolysis, what is the classification that we have? We have the Lansfield classification. They will ask you that what is it based on. You have to pick up the C out of it, and you have to say that the Lansfield classification is based on the C antigen. It is based on the C antigen, and that is what divides it into what? It divides it from A to V. However, there is no I and there is no J. No I and J, but divides it from A to V. But please note, out of these, I'll give you some examples. If I say Group A beta hemolytic streptococcus, what is that? Streptococcus pyogenes. If I say Group B beta hemolytic streptococcus, that is going to be Streptococcus agalacti, which I will talk about. So Group A is pyogenes, Group B is agalacti. Fine. Before I get on to the details, this Group A can further be divided on the basis of two typings. There is known as only for Group A, there is something known as a Griffith typing, and there is something known as EMM, that is M typing. And please note that the Griffith typing is based on M protein. What is the basis of the Griffith typing? It is M protein. And what is the basis of the EMM typing? It is the gene for the M protein. Sounds very similar, but is a little different. One of them is based on the protein ka typing. On the basis of the protein, you have Griffith typing. But EMM is on the basis of the gene that is coding for the protein. But both of these typings are applicable to which one? Group A. Group A matlab kya? Streptococcus pyogenes. So repeating, alpha hemolysis had two things, VP, viridans and pneumoniae. Gamma hemolysis just as Enterococcus. Beta hemolysis is going to be classified as per Lansfield. Lansfield ka question 1 methodology, carbohydrate antigen. A to V ka groups hota hai, out of which there is no I or J. A is further divided on Griffith and EMM typing. Before I go into their details, let me start off with your journey, especially talking about Streptococcus pyogenes all throughout. What are going to be the virulence factors that we have? Let us start with Streptococcus pyogenes only, which is group A, beta hemolytic. So I'm in the beta hemolysis. That is very commonly asked. So I'm in the beta hemolytic zone now, right? Okay, what are the enzymes? जल्दी से देखो, streptococcus है तो streptokinase तो होगा. I hope you know streptokinase is something which we take from here and use somewhere in medicine. Streptokinase also has fibrinolytic activity. So is it used in cardiac patients as a drug? Yes. So that is where the streptokinase comes from. It has two more enzymes called hyaluronidase and DNase B. Out of them, I said only DNase B because ABCD बहुत सारा DNase है. But I hope you remember anti-DNase B is something which is very commonly tested in a lot of disorders. For example, in pyoderma. It is also important for the diagnosis of post-streptococcal glomerulonephritis. Anti-DNase B is the one that is used for their testing. What else do we have? There's something known as streptolysin in streptococcus. So common sense. Streptokinase, streptolysin, ये तो होगा ही. Hyaluronidase and DNase is what I have to learn. But you actually get a question on SPE, streptococcal pyrogenic exotoxin. What is so famous about it? Because everyone heard streptococcus causes scarlet fever and TSS. Yes, scarlet fever is caused by streptococcal pyrogenic exotoxin and toxic shock syndrome. So that means toxic shock syndrome could be caused by Staph aureus also, and it can be caused by streptococcus pyogenes also. Fine. Out of all of these, if I say किसी का blood test करना है and you have to find out that does a person have infection or not with streptococcus, you'll say, ma'am, I'll find out antibodies. What antibody testing do? You do anti-streptolysin antibody testing. Means there must be some antigen. Yes, the bacteria has streptolysin O antigen and the bacteria has streptolysin S in it. Which is the antigen? I said whenever you have to do the testing, you do anti-streptolysin O antibody. So what is the antigen? Streptolysin O must be antigenic. That is why we have antibodies against it. So I will learn everything about streptolysin O. He is the hero over here. So everyone in the exam, you will go and write streptolysin O, and that looks like slow. Pehle slow likhna, and now read it opposite. OL, what is its oxygen ability? Oxygen labile. OL, oxygen labile. And SS, what is SS? It is stable in the serum. It is serum stable. So slow and steady. Slow and steady is how I have learned it. So remember, steady and slow or slow and steady. So ulta pado. Slow ka ulta pado. It is oxygen labile. And it is serum what? It is serum steady. It is serum stable. These two features are asked a lot in the exam. Baki sab ulta. For SLS, which is non-antigenic, I will keep everything ulta. Okay? And which is antigenic? This slow is antigenic, oxygen labile, serum stable. And remember, because it is oxygen labile, labile matlab it's going to break off. It's not going to work in oxygen. So will it ever show you hemolysis on the surface? If this, for example, is a blood agar, will it ever show you hemolysis on the surface? No, surface has a lot of oxygen. It will say, oh, I am oxygen labile. I am not working here. I will show you chupke. I will show you hemolysis niche. So where does it show you hemolysis? It shows you hemolysis in a deeper plane, not on the surface. That is your methodology of learning all these toxins and virulence factors. Now we come to what are the streptococcus pyogenes. What does it cause? It causes some suppurative things and it causes some non-suppurative things. So let us get going. Under the suppurative things, the first thing we have is necrotizing fasciitis, which I'm sure all of you have read about. I stands for impetigo. These are all skin related things. Next, what do we have? We have the famous pharyngitis and pneumonia. Of course, streptococcus has to cause pharyngitis and then pneumonia later on can happen. What is L? L stands for lymphatic involvement, lymphangitis. So what is E? E stands for erysipelas, which are raised lesions on the skin, as all of you know. And S finally stands for scarlet fever. And I think everyone is aware that scarlet fever shows you the famous strawberry tongue. Guys, I'm not writing it, but I'm sure you know which is the disease in pathology which shows you the strawberry tongue. It is the Kawasaki vasculitis. That also shows you strawberry tongue. So yes, necrotizing fasciitis, impetigo, erysipelas, and scarlet fever. These are all skin-related etiologies. Pneumonia, pharyngitis are the two P's, and L for lymphangitis. So suppurative lesions have nipples, and non-suppurative lesions for streptococcus pyogenes is so simple. In the heart, it of course causes rheumatic heart disease. In the kidney, it causes PSGN, and it also causes a disease called PANDAS. You don't have to know the full form of it, but it is a pediatric psychiatric, autoimmune, neuropsychiatric disorder associated with streptococcus. So what is it? It is a neuropsychiatric disorder, and this neuropsychiatric disorder is nothing but the OCD. OCD is usually what is the spectrum that comes. These are all under the non-suppurative etiologies. Let me give you an example. They give you this kind of a picture. Can you see a discharge that is present over the facial region and the soft palate? That is what you see classically in case of pharyngitis. Patient will come to you with pain. Maybe there will be some lymph nodes also that will be associated with it, painful lymph nodes, and this is not the cough wala problem that the patient will have. So what are you going to give as a treatment? Treatment is going to be penicillin. So this is how a typical case of pharyngitis with Streptococcus pyogenes comes. How do we finish off the lab diagnosis in one slide? That's the best possible method. Whenever we say Streptococcus, the arrangement has to be in the form of chains. Number one. Next, when I look at the blood agar, if I see there is a pinpoint colony. Look at the colony, guys. It's just looking like a point, pinpoint. And if I look at the amount of blood broken, it's too much of blood broken. There is a wide zone of hemolysis that I see. Remember, Staph aureus had a narrow zone and Streptococcus has a wide zone of hemolysis. If you have collected a sample from a patient, how are you going to transport it? What is the transport media? That is going to be the Pike's medium. Okay. Now we come to how do I learn it? So remember, when you write in the exam, Streptococcus pyogenes, remember pyogenes mein number one, what colonies do you have? You have pine point colonies. Fine, if I ask you what zone of hemolysis, you will say wide zone of hemolysis. And if I ask you what is going to be the transport media, you will say it is the Pike's media. Can you see pi, y? Everything in pyogenes goes as pine point colonies, Pike's media, wide zone, pi, y chalega. Coming to the selective media, for that also you will write Streptococcus pyogenes because P will remind you of the PNF. PNF media for P. Out of the Y, you will make a V because this is the most important. Crystal violet blood agar. They will definitely ask you this question in the paper. Crystal violet blood agar is used for Streptococcus pyogenes. And what is the O? On a liquid media, you show granular turbidity. You see granular turbidity. So repeating, Streptococcus pyogenes. P for PNF, Y ka V, that is going to be crystal violet, and O is going to be the liquid granular turbidity. Coming to the biochemical reactions, for that also you will learn Streptococcus pyogenes only. Why? Because as soon as you write Streptococcus pyogenes, number one, I can tell you what is the PYR. Of course, the PYR test is positive. And if they ask you bacitracin is what? Sensitive or resistant? You will say bacitracin is going to be sensitive. So simple. S is going to be bacitracin sensitivity. PY is going to be PYR test positive. And of course, this you already know. Catalase and oxidase. Catalase was not Streptococcus. Catalase was a mnemonic we've done earlier. So all those things are not there. Two things are there. One is bacitracin sensitivity and other is PYR positive. Everything about Streptococcus is done from its name. Streptococcus pyogenes tells you selective media. This pyogenes tells you biochemical. Pi, Y tells you all the features and the transport media. What is the treatment? You know it's penicillin. In case of resistance, you go in for erythromycin. So please note this was Streptococcus pyogenes, that is group A beta hemolytic Streptococcus, because now I go on to group B beta hemolytic Streptococcus, that is known as Streptococcus agalacti. So what is agalacti? If you remember, I told you gala. This sounds like gala. So hip hip hooray. That is how we had learned. Hip hip hooray, because we are going to have a gala time in the camp. We are going to have a gala time in the camp. What does that mean? So gala basically means for agalacti. Hip hip hooray means that in terms of the biochemical reaction, this is the one that is going to show you hippurate hydrolysis positivity. Hippurate hydrolysis is seen over here. And what is the camp? Because this is going to be camp test positive. What is camp? Camp ka full form kya hota hai? There were 4 scientists that gave it. You just have to go through it once. Christie, Atkins, Munch, Peterson. 4 scientists who gave it. And what do you do in this? Over here on the vertical line, you first strike or you make a stroke of Staph aureus. Did I teach you Staph aureus is hemolytic? Yes. After that, perpendicular to it, you make a gala time, that is agalacti. So one line like this, Staph aureus, one line like this, that is agalacti. Wherever they will meet, there will be too much of hemolysis. Why? Because this is also hemolytic. This is also hemolytic. So, khoob jamega rang, do yaar, that is how it is. This is also hemolytic. This is also hemolytic. Whenever they will meet, there will be an enhanced zone of hemolysis. That is going to be known as The arrowhead hemolysis, right? So remember, HIP stands for hippurate hydrolysis, GALA for agalacti, CAMP for CAMP test positivity. After that, you should be knowing some miscellaneous things. It is bacitracin resistant, of course, because bacitracin sensitive to Streptococcus pyogenes tha. So this is going to be bacitracin resistant, and if you can learn, it produces a red color pigment on Islam's media. But karata kya hai? Primarily, this is something that can happen in neonates and newborn children also. Neonates and older भी 7-8 year old children का disease basically ज़्यादा है, because hip hurray is something that बच्चास do ना. Hip hurray, the बच्चास are gonna have a gala time in the camp. So meningitis, pneumonia, sepsis in the kids, these are the kind of things that it causes. Your beta hemolytic category is done, guys, because now I'm going to go on to the alpha hemolytic category, and that is going to have VP. What is VP? Streptococcus viridans and Streptococcus pneumoniae. Out of them, remember, viridans is very resistant. Means you ask him anything and his answer will be no. He's very tough. You try to break him, he will say no. So firstly, how is this arranged? This is arranged in the form of chains. Okay, it's arranged, it's very tied up. It's tied up in the form of chains, and you ask him anything, he will say no. So you will say that, listen, will you do bile solubility for me? He will say no, I will not do it. If you say, listen, will you be sensitive to optochin? He will say no, I will not be sensitive, I'm very resistant. You will ask him, will you do inulin fermentation? He will say no, I will not do it. So this viridans is very resistant. That is how I have learnt it, and he is there tied up in chains, and he is going to say no to what? Anything out of bio that you ask him. Means you ask him about bile solubility, optochin sensitivity, and inulin fermentation, everything to bio, he will say, I will not do it. You know, viridans is just a name. Viridans has many people under it. One is going to be Streptococcus mitis, Streptococcus mutans. Mutant sounds like mouth. Streptococcus mutans sounds like mouth. So this is what is going to have dental caries. Very important PYQ. Then we have Streptococcus sanguis, and this is asked in terms of prosthetic heart valve endocarditis. Again, something which is a PYQ. And salivaris. Salivaris, you have studied this in your general also. This is the only organism that can have both things. It can have a capsule as well as a slime layer. Both the things are possible. So remember, mutants goes in mouth with dental caries. Sanguis is going to cause less prosthetic heart valve endocarditis, and salivaris has both. That is, सब कुछ है उसके पास. Saliva has सब कुछ. Salivaris has capsule and a slime layer. That makes up your Streptococcus viridans family. Very resistant, saying no to everything, because now I'll tell you Streptococcus pneumonia, which will say yes to everything. Means if you ask him about the bio thing, and you ask him, will you show me bile solubility? He will say yes. Will you show me optochin sensitivity? Yes. Will you show me inulin fermentation? Yes. He's gonna say yes to everything. So imagine if you are a PG resident and everything that your HOD asks you in your bio data, if you say yes, I can do this also, I can make tea also in the department, I can take care of patients also in the department. If you say yes to everything in the department, you are gonna have a gala time. You are gonna enjoy the department. Your thesis will be done. You will pass your MD exam. You will basically get a license. You will get a license to enjoy life. That is, you will be playing carom in your PG and enjoying life. You will not be working. License means this is a lens-shaped organism. It is a lens-shaped, lanceolate-shaped organism. I'll show you a picture, an enlarged picture of it. Can you see? It is a lens-shaped organism, and I can also see a capsule around it. Your HOD will be very possessive about you. He will give you license to do anything, and he will protect you with a capsule. Guys, whenever a capsule is there, this means it's an antigen. There are more than, not even 90 now, more than 97 serotypes are known based on the antigen that you have. And what is the testing that you do for antigen? You do a Quelang reaction. I have taught you this earlier in the main videos also. What is Quelang reaction? I told you that capsule is basically going to have an antigen. If you add an anti-sera to the capsule, there is going to be swelling. Basically, antigen antibody reaction hoga. There is going to be swelling. So we had learnt it by a mnemonic that Quelang is swellang. That is how we learn it. Quelang is swellang. It is going to show you a swelling around the capsule. What are the clinical features? You know Streptococcus pneumoniae, so to think of something from ENT point of view, it is going to cause otitis media, it is going to cause sinusitis, it is going to cause community acquired pneumonia. understood things. Other than that, it can also cause meningitis. So it had got a lens, or a license, and the HOD was protecting it. And what is he going to do? Now he's going to enjoy life and he's going to play carom in the department. So these are known as carom coin colonies. What is the other name for carom coin colonies? They are also referred to as the draughtsman colonies. They are also known as draughtsman colonies. So now they also ask you a question that why do you see carom coin or draughtsman colony? What is the reason for it? It is due to an autolysin. Apne aap. It is killing its own self. If you're not studying in PG and you're only playing carom, so you are doing harm to yourself only. It is an autolysin, also known as amidase. Amidase or autolysin is what you have to know. That is why the center is getting a little depressed like a carom coin because of that autolysin property. So I've tried that in one slide. I can teach you everything. Streptococcus pneumoniae is that good PG resident who has said yes, yes, yes to everything in bio. He has got a license to play carom in the department. When I ask you about the treatment of this, you know it is going to be beta-lactams. Resistance hai, to of course you can use cephalosporins, but beta-lactams is what you start with. And of course the prevention, you know there are two vaccines. One is known as the Pneumovax and one is known as Prevnar. Chota wala naam, bada wala naam. So Pneumovax, pneumonia ka vaccine is going to have how many? What is the valency? It is a 23-valent polysaccharide vaccine. 23-valent, right? And whom will you be giving it to? You will be giving it to thoda bada bachas, children above 2 years of age. It is indication is above 2 years of age. It is not given below 2 years of age. So simple yaad rakho, big wala name has big valencies, 23 valencies, 23 serotypes it can protect against, and it is given to bigger children above 2 years. Whereas Prevnar, chota wala naam, is going to have only 13 valencies and is given to chota kids. It can be given to children below 2 years of age. Simple. Big name, big valency, bigger kids. Small name, small valency, smaller kids. Alpha hemolysis is also done. We now go on to the last one, and that is the gamma hemolytic, and gamma one is going to be Enterococcus. How is the methodology of learning Enterococcus? The gamma hemolytic, we have Enterococcus faecalis and faecium, which is faecalis is the most common, and I'll tell you what it causes. So in one slide I can explain Enterococcus to you guys, but you have to learn the word Enterococcus for that. So let's start. Everywhere the rule is the E's will be converted into a B, not a problem. The E's will be converted into a B like this. So when I start with the first one, and that is going to be E for Enterococcus, the E changed into a B and it started looking like a spectacle. This is a spectacle shaped organism. Yes, I can see these two sets coming together. They are spectacle shaped organism. Perfect. Then we come to NNN. What is NNN? It is non-motile, it is no sporing, and it can also tolerate NaCl 6.5%, NNN. Then what is the T? What else can it tolerate? Guys, it is also heat tolerant. It is also tolerant to heat. So simple. It is non-motile, it is non-sporing, it is NaCl tolerance of 6.5%, and it is tolerant to heat. Now entero, another E coming up, but I had a rule, the E will always be changed into a B. So is it resistant to bile? Yes, even 40% bile it can tolerate. You'll say, ma'am, it is so nice, it can tolerate 40% bile, grow it in bile. The agar that you will use is the BEA agar, the bile esculin azide agar. That is what they will say. And what color did you see when you're getting Enterococcus growth? What color did you see? You saw a black color. So bile esculin azide agar is going to give you B for B, that is a black color. Bile 40% it can survive. And entero R, what is the reaction? It is PYR test positive. Jaldi se revise karo. E makes a B, so spectacle shape. NNN, non-motile, non-sporing, NaCl 6.5%, tolerant to heat. E becomes a B, bile esculin azide agar, bile 40% survive karega, and it's going to give a B for black color. Finally coming to R, PYR test positive, Enterococcus. What is us telling you? It causes UTI and it causes septicemia. That is the entire story of Enterococcus. How do you treat it? Of course, ma'am, simple hai. We always treat it with penicillin. Resistance hua, so penicillin ka resistance over here is treated with vancomycin. But is vancomycin resistance also known? Yes, there is vancomycin resistant Enterococcus. What does that mean? Why does that happen? Vancomycin resistance Enterococcus is because of the VAN-A gene. You know what has happened in the bacteria? How has it become resistant? In the bacteria, we have something called D-ALA. All the cell walls of every bacteria have D-ALA. That D-ala changes either to D-ala D-lactate or it can go into D-ala D-serine. So you will say, now ma'am, the structure of the cell wall has only changed. The cell wall is so smart. The bacteria has changed his name only. That how will my vancomycin go and attack? Vancomycin was told go and attack Enterococcus. Address of Enterococcus is D-ala D-ala. Enterococcus changed its address. He started saying my address is now D-ala D-lactate. So now vancomycin is lost. That is why this is vancomycin resistant Enterococcus, to which now we give linezolid. That's the entire story of Enterococcus. That means, guys, all your gram-positive cocci are done, and now we can quickly pick up the exceptions. Staph, strepto, gram-positive cocci ho gaya. Now we pick up the exceptions, that is venom. I'm going to start off with the first exception, that is Neisseria, and Neisseria includes two things, as all of you know, Neisseria meningitidis and Neisseria gonorrhea, as the name suggests. Tell me, Neisseria meningitidis, meningitis karayega kahan se? Normally it's an inhabitant of what? Normally it is an inhabitant of nasopharynx. And Neisseria gonorrhea, gonorrhea you know genital infection hai, it's an inhabitant of the genitals. What disease does it cause? So for the disease, obviously mota, so if I tell you, you will say ma'am meningitis will cause meningitis and gonorrhea will cause gonorrhea, which is nothing but a sexually transmitted disease, but that's not it. I want to elaborate on this a little. Please note that Neisseria meningitidis causes something known as, agreed with you, meningitis, but does it cause something in the adrenal glands? Bilateral adrenal gland problem. What is that? Bilateral adrenal hemorrhage called Waterhouse-Friderichsen syndrome. We all have studied it is because of meningococcemia. This is what will be written in the paper. It is because of meningococcemia. So remember, bilateral adrenal hemorrhage, Waterhouse-Friderichsen syndrome. Meningitis to dekho sabko yaad hai. This is what you have to learn. What does Neisseria gonorrhea cause? Again, gonorrhea everyone will learn. But what apart from gonorrhea? What consequence of gonorrhea? So of course, gonorrhea, when I say and you say, ma'am, it is a sexually transmitted diseases, I ask you what is the most common presentation in males? You will say urethritis. And the most common presentation in females is cervicitis to begin with. After that, vaginitis can occur, males may prostatitis, seminal vesicles, epididymis, everything can be affected. I'm telling you most common things. Males may urethritis, females may cervicitis, and when it goes advanced, it can result in water can perineum. There are discharging sinuses, multiple discharging sinuses that are created like a water can for watering the plants. Multiple pus points are there in the skin in the perineum through which pus comes out. Now, tell me, if a child is born in a mother who is having gonorrhea, will the child have, while passing through the birth canal, can the child's eyes get affected? Yes, ophthalmia. Neonatorum is positive. Iska complication kya hoga? There is a very famous syndrome called Fitzhugh-Curtis syndrome. Fitzhugh-Curtis syndrome, pehle to you should be knowing hota kya hai. It is nothing but an involvement of the liver. It is a perihepatitis. And secondly, it is also seen with not only Neisseria gonorrhoeae, it is also seen with Chlamydia trachomatis. I'll show you this, I'll tell you this in Chlamydia trachomatis also. It is nothing but what? Fitzhugh-Curtis syndrome. It is going to show you involvement around the liver. If they show you a liver specimen and they say that, okay, this is a liver specimen and it has fibrosis or perihepatitis, something around it, that is Fitzhugh-Curtis syndrome. What else? Neisseria gonorrhoeae ended up happening everywhere in the body. Disseminated gonococcal infection, disseminated all over the body. That is what is gonorrhea. Jaldi se recap. Meningitis causes meningitis, common sense, but other than that, Waterhouse-Friderichsen syndrome. Gonorrhea causes gonorrhea, but what is it? Urethritis in males is common, cervicitis in females is common. In children, mother to child, ophthalmia neonatorum. As a complication, Fitzhugh-Curtis and the disseminated infection. Now coming back to the table, I've told you the diseases. Now let's talk about the fermentation. So now see, gonorrhea only has G in it. So the fermentation is going to be for glucose. Whereas meningitis has G, so fermentation of glucose yahan bhi hai, but M also, this means maltose. So remember, there is a maltose plus there is a glucose fermentation in meningitis, whereas in gonorrhea there is only a glucose fermentation. Coming to the shape, meningitis, the way you write M, you can make a lens out of it. Also, you will make a capsule around it. This means meningitis is also going to not just be lens shape, meningitis is also going to have a capsule around it. Gonorrhea, I've written one G like this and one G like this because it's going to be a kidney-shaped organism. Next, I told you space being made. I told you, both of them are catalase positive. Remember, both of them are oxidase positive also. Let me show you the oxidase test that is done. This is an oxidase test which gives you a purple color. When you get a purple color, that is indicative of an oxidase test, and that is positive in both Neisseria meningitidis and Neisseria gonorrhoeae. Please note, Neisseria meningitidis is a strict aerobe, whereas gonorrhea becomes ulta. That is a facultative anaerobe. The story is not over. The table is continuing. Now you need to know what are their virulence factors. So now I realize virulence factor same lag raha hai, ma'am. Both of them are having IgA protease. Both of them have endotoxins in them. Yes, because they are gram-negative. Gram-negative organisms have endotoxins. Both of them have pili. Oh, is there something special about this pili? Yes. This type 4 pili that both of them have, pili is never for movement. Movement के लिए क्या होता है? Flagella. But can they show you motility because of this? Yes, we have noted that there is an element of motility that is seen along with Neisseria sometimes because of this type 4 pili. Now coming back, both of them, इन दोनों में से capsule किसके पास था? You will say, ma'am, meningitidis had that capsule. So who will have capsular polysaccharide as a virulence factor? Meningitidis. What are the serotypes? ABC. ABC तो याद रहेगा. Y and W135. ABC, Y and W135. What is the point that they really ask you in the exam over here is that please note that we know that there is a meningococcal vaccine. When we are talking about a meningococcal vaccine, it is going to provide protection. So meningococcal vaccine किस से बनता है? It is made from, what are the serotypes? ABCY W135. You will say, ma'am, meningococcal vaccine has everything except B. Basically, B is not there in the meningococcal vaccine. So they ask you that this vaccine does not provide protection against. It does not provide protection against serotype B. That is why we are having a very important MCQ over here. So remember, meningococcal vaccine does not provide protection against the B wala serotype. Rest it provides protection against all these capsular polysaccharides. So A, C, Y, W135. But capsule is only in Neisseria meningitidis. It is not in Neisseria gonorrhoeae. Both of them have something called outer membrane protein. Okay. But Neisseria gonorrhoeae has protein 1 and protein 2. Even if you don't learn all of this, please note protein 1 has something called pore B1A and pore B1, protein 1. Pore B1A causes disseminated gonococcal infection. Important for INICET aspirants. How I have learned it is pore B1A is going to cause a lot of infection. A lot of infection matlab disseminated infection it will cause. Okay? So now one thing you should know that meningitidis has a capsule wala problem and gonorrhea has the disseminated pore B1A wala problem. Rest both of them have IgA, both of them have endotoxin, both of them are going to have pili. That is common. Dono ka transport media is also the same. There is something known as the amines or the Stewart media. The amines or the Stewart media, which is a charcoal-based media, that is going to be a transport media to both of them. And what is the culture media? Culture media is also the same. It is the modified Thier-Martin medium. So I'll write it in a continuation. It is a modified Thier-Martin medium, which I can use for both of them. What is modified Thier-Martin medium? See, pehle we used to say Thier-Martin medium. Now we've said modified. Something extra has been added. So please note, till the time I was using these three things, vancomycin, colistin, nystatin. Vancomycin, colistin, nystatin, it was Thier-Martin medium. Now I've added an extra T to it. When I've added trimethoprim to it, now it has become modified. That could be a question. The addition of trimethoprim has made it a modified Thier-Martin medium, which I use for meningitidis and gonorrhea. Finally, the treatment. IV ceftriaxone is for both, of course, but please note that for Neisseria gonorrhoeae, genital infection, other than IV ceftriaxone, you will also have to give up the azithromycin. That is something that is extra over here. So remember, IV ceftriaxone for both, and for gonorrhea, it is also going to be azithromycin. I hope you've been able to understand this in the form of these two tables. One table I made for all of you, which was to do with all the biochemical things. One table is to do with all the virulence factors and its media and all of that. Finally, we come down to not only Neisseria, one more was there, Moraxella. Do Moraxella jaldi bata do. There is something known as Moraxella cataralis. As soon as I say catarrhal means something to do common cold, cough, all of that, ENT wala problem. So there is going to be otitis media. Moraxella catarrhalis causes otitis media. Also, it causes COPD exacerbations. Guys, if you have a case of emphysema or chronic bronchitis, the most common infection that you have in COPD patients, no, it's not Moraxella. It is Haemophilus influenza, the most common infection in COPD patients. But now if I ask you, the second most common infection that you have in COPD patients, and that is going to be Moraxella. Can you see if there's a colony formed? I'm taking a loop and I can't show it to you because it's a static picture, but this, if I put pressure, that colony will move forward, just a hockey khel rahe ho. This colony will now come and sit over here. Then you'll push it a little, this colony will come and sit over here. This is known as the hockey puck sign. That could be a fancy question for Moraxella catarrhalis. Whereas there is one more Moraxella. What is Moraxella lacunata causing? Lacunata, you can see the picture in front of you. It is causing angular conjunctivitis. That is a question that you get in ophthalmology. Yes, on that note, you have wrapped up all of your gram-positive cocci as well as gram-negative cocci. But now do you know what are we starting with? We are starting off with the bacilli family, and I have already taught you this. All the bacilli are gram-negative except McDonald's. We have studied this mnemonic. Now out of this, what I'm going to tell you first is the very, very famous Corynebacterium and diphtheroids. The D and D is what we are going to pick up. Corynebacterium, diphtheria and the other diphtheroids. Then we'll first finish off the exception wala list. I'm not going on to the usual bacilli. I said all the bacilli are gram-negative except McDonald's, which is gram-positive. So I'm first starting off with this McDonald's mnemonic and then I'll move on to the rest of them. Hi everyone, having discussed the gram-positive and the gram-negative cocci, let us go on to the bacilli as we just discussed, and under this we'll be starting off with the family of the gram-positive bacilli. Those are the McDonald's, and that includes the first one, that is Corynebacterium, diphtheria and diphtheroids. When I talk about Corynebacterium, diphtheria, this is the collage or the overall review that you have to know for this organism. Corynebacterium, diphtheria, before I begin with all of these features, has a toxin which is very famous called the diphtheria toxin. I'll tell you the mechanism of action in a while, but let me tell you that this diphtheria toxin is something that is going to be dependent on iron levels. So they ask you that which of the following toxins are dependent or regulated by iron, and that is going to be the diphtheria toxin. Second question that you should be knowing is that after every toxin, don't you know already that from a toxin a vaccine can be made? So they say that we can convert this toxin into something known as toxoid, and if you convert it into toxoid, you have basically made it into a vaccine. How do you convert it into a toxoid? By using an acidic pH and by using formalin. That's another question that you can get in PSM. How is diphtheria toxin converted to toxoid? That is used as a vaccine by acidic pH and by formalin. Okay, so now coming all the way back, asking you what is the mechanism of this diphtheria toxin which causes all these diseases that I'll be talking about. So there is a common list that I'm going to tell you about all the toxins that are going to decrease the protein synthesis. What are the points that I've highlighted? DPS, decreasing the protein synthesis, are toxins which are DPSS, means number one, the diphtheria toxin, and P for exotoxin of Pseudomonas. Now I know in the exam when you'll go D for diphtheria toxin you will find out, but P will give you a confusion. Proteus tha, Pseudomonas tha. So remember P and S, you pick up P and S, that means you're talking about Pseudomonas. Then what is the S individually? S individually, Shiga toxin, Shiga-like toxin. So no points for guessing that Shiga toxin is released by Shigella. Shiga-like toxin or verocytotoxin is released by E. coli. So repeating, when they say which are the toxins which decrease the protein synthesis, we have diphtheria toxin, we have Pseudomonas, we have Shiga toxin and Shiga-like toxin. 4 toxins are there. All of them decrease the protein synthesis, but their mechanism is different. How do these two decrease the protein synthesis? They are going to cause ADP phosphorylation of the EF2. Remember, diphtheria toxin and the Pseudomonas, they are going to cause ADP phosphorylation of EF, elongation factor 2. That is how they decrease the protein synthesis. Remaining two, Shiga and Shiga-like, keep them together. They are going to inhibit the 60S ribosomes. They inhibit the 60S ribosomes, and that is how they decrease the protein synthesis. So see, the outcome is the same. All of them decrease the protein synthesis, but how they do that is different. So I hope the flashcard is ready. Coming back to diphtheria toxin, you know know it is going to be decreasing the protein synthesis. How? By affecting elongation factor 2. Now let's move on to what are the forms, different forms of diphtheria. The first one, which is the most common that you see in front of you, is the respiratory or the fascial diphtheria. What do you see in it? I can see there is a pseudo membrane that has gotten deposited onto the soft palate. So this pseudo membrane is the reason that it's called fascial or respiratory, because this is in the soft palate and the laryngeal, so it's a respiratory area. Also I see that this is like a celebrity kid. You can see the bull's neck appearance. This bull's neck appearance is because of a lot of lymphadenopathy that has happened over here. So this is the most common form of diphtheria that we encounter. Other than this, we have the cutaneous forms. Cutaneous means that the patient is going to have ulcers, and if multiple organs are affected, especially the nervous system, CNS, PNS, that is systemic. So most commonly respiratory, then we have cutaneous and systemic. So how are you going to go ahead with doing the diagnosis of this? Please note that I am going to basically take this sample, this pseudo membrane I will take, but I will remove the membrane and take a swab from underneath the membrane. So please remember, I will take 2 swabs. What did I say? I will take 2 swabs. How? From below the membrane. You are not going to take the membrane, because the membrane is all dead material. You don't want to see dead material under the microscope, right? You want to see the organisms. You remove the membrane and you take a swab from under the membrane, and what do you see? Have a look at this. Corynebacterium diphtheria, I think everyone knows, is famous for being called as the Chinese letter appearance. Anything other than Chinese letter that you can call it, we also call it the cuneiform appearance. So we see that Chinese letter, I don't know Chinese, but if I look at letters, they are going to be V, L, these random shapes. So yes, when I look at this, I can appreciate that there is a V shape, L shape, those kind of shapes are definitely noted. Why are they purple? Because I'm talking about gram-positive bacilli for the time being, isn't it? Yes, so now you'll ask me, why are they V-shaped? Why are they joint? Basically, some letter you'll see they are joint, and that is because of snapping division. The reason for that jointedness is going to be snapping division, which means that one bacteria divided into 2, but they didn't separate. Division to hua, but they did not separate. So basically they are like conjoined twins. That is how I've learned it. Okay, these are like conjoined twins. So the reason for Chinese letter is snapping division. Further, if you zoom in and see, you will also notice that their ends are very prominent, bulbous ends. Why? Because now I need to see that on a special stain. Yes, I can see very clearly that the ends are very prominent. Those are known as the volutin granules. Firstly, guys, do all the special names of these granules. So volutin is one name. There is another very special name known as the Babes-Ernst granules. These are all scientist wala naam. Then you have some real names. Bipolar. Why bipolar? Because you're seeing them at the 2 poles. You're seeing them at the 2 poles. So they are definitely bipolar, and they are also metachromatic granules. So volutin, bipolar, metachromatic, Babes-Ernst, they all mean the same. But what do they contain? We say they contain polymetaphosphate. And polymetaphosphate is nothing but what? ATP, ADP ke liye phosphate na. So in short, they are energy sources. Now you'll have to say that what is that stain that you have used over here? So what I've used in this particular slide is the Albert stain. Now they will ask you what is the composition of the Albert stain. So there's a very simple thing. In the exam, you get 2 solutions. One is going to be Albert 1 solution, and the other one is going to be the Albert 2 solution. I'll tell you what all is added in each one of them. The main stains. What are the main colors, ma'am? I can see one green color, one purple color. Kuch green hai, kuch blue, purple hai. ठीक है. So the green color and the purple color. So the purple color is going to be toluidine blue, and the green color is malachite green, and both of them are present in the Albert 1 stain only. What is present in Albert 2? Albert 2 basically has iodine. So how simple to learn? If I have to learn what is the composition of the Albert staining that we have, you will simply say that I can learn it as a mnemonic TIM. What is TIM? T for toluidine blue, I for iodine, M for malachite green. The main colors, the toluidine blue and the green, are present in the first stain, and the remaining iodine is present in the second stain. So I could easily see. Now tell me, indirectly let me ask you a question. Organism ka kya color hai? Ma'am, it is something green, malachite green, and the volutin granules are what color? Blue, purple, toluidine blue, hai na? Now, is there any other stain other than this for volutin granules? Yes, there is something called, we learn it by the famous mnemonic plan. Guys, this is a very famous question, and you have to learn this with me. Quickly revise. P for what? Ponder stain. L for Loeffler's methylene blue, A for Albert, Tim you have studied, and N for the Neisser stain. Now this is a question that has come multiple times in the exam. You don't have to falter on this. What is your plan for the volutin granules? Ponders, Loeffler's methylene blue, Albert and Neisser's. Nowadays the question is which is the best stain? Loeffler's is now said to be the best stain out of these. So although it's very cluttered, but I've tried to make one common flashcard for you guys, starting from gram staining, how the snapping division occurs and its Chinese letter or cuneiform. Going on to the volutin granules, it is made up of what? It is made up of energy sources. So basically it is made up of polymetaphosphate. What is your plan for staining? Plan, ye wala kaun sa hai? This is Albert. What is the mnemonic for Albert? It is Tim. And which is the best one? It is Loeffler's methylene blue. This was all about the slide wala features. What about the culture characteristics for Corynebacterium diphtheria? First, everyone tell me, what is the other name for Corynebacterium diphtheria? It is known as the Kleb-Loeffler's bacillus. It is known as the Kleb-Loeffler's bacillus. So I realize everything about diphtheria is Loeffler. Matlab, if I ask you what is the enriched media, guys, enriched has how many alphabets? 1, 2, 3, 4, 5, 6, 7, 8. Enriched media ka 1, 2, 3, 4, 5, 6, 7, 8. Loeffler is the media. Loeffler is the name of the organism. Loeffler is the name of the media. Life is simple. ठीक है, तो Loeffler serum slope. Why am I counting 8? Enriched has 8 alphabets. Loeffler has 8 alphabets. So the time to grow on this media is also going to be somewhere around 8 hours. 6 to 8 hours. Simple. So this has 8 alphabets. This also has 8 alphabets, and the time to grow is 8 hours. But if I ask you what is the selective हमेशा best media होता है. Selective is going to be potassium tellurite agar, which is also referred to as the Tinsdale medium. And they always say that whenever the word tellurium will come, tellurium will always give a black color. So here I have a black color in front of me, and the time to grow on this is 48 hours. So now tell me something. Dekho, out of an enriched and a selective media, which is always the best, of course, no doubt, selective is the best. So if they ask me which is the best media for Corynebacterium diphtheria growth, I mark selective. But if they ask me which is the one which will help me in early diagnosis, I can see that enriched is helping me in early diagnosis. That is all that you have to read carefully in the paper. Corynebacterium diphtheria ka this celebrity kid bull's neck will be given. They will say you want to make the diagnosis of this kid as early as possible. What is the media that you will use? Early pucha, I will write enriched. Best medium, if they ask me, I will write selective. I hope that's okay. Shall we move on to the next? So see, I've got you flashcards. One was taking care of all the slides. This is taking care of all the culture media. The next will take care of all the tests. There is an LX gel precipitation test and one is a Schick test. So please note, both of them, so they ask you simple one-liners. If you want to know the toxigenicity of a bacteria, means am I having a toxigenic Corynebacterium diphtheria? Am I having a non-toxigenic Corynebacterium diphtheria? तो कौन सा test करोगे? You will do the LX gel precipitation test, right? I hope you remember from your immunology chapter that this is going to be a double diffusion in 2 dimensions. What kind of a test in immunology is it? It is a double diffusion in 2 dimensions. तो क्या होता है? Simple, ma'am, I am going to look out for these lines. What have I done in this test? On this strip, I have taken the antitoxin. Basically, toxin antitoxin ka reaction hai, nothing fancy. On this strip over here, I have taken the antitoxin. Sorted. After that, I will see that I will keep different Corynebacterium diphtheria. Concept क्या है? If a toxin is there, टॉक्सिन एंटीटॉक्सिन का रिएक्शन हुआ, लाइन आएगा. टॉक्सिन एंटीटॉक्सिन का रिएक्शन हुआ, लाइन आएगा. टॉक्सिन एंटीटॉक्सिन का नहीं हुआ, तो देयर इज नो लाइन ओवर हियर. सो बेसिकली द कॉन्सेप्ट नाउ कम्स डाउन टू द फैक्ट, लेट अस रिपीट दिस, दैट इफ आई कुड सी वन एंटीटॉक्सिन, दिस आई हैव एडेड. After that, when I put a toxigenic strain, line आया बिल्कुल. When I put a non-toxigenic strain, there is no line around it. So now if I ask you, what do you think is the situation of this patient over here? Is he having toxigenic or non-toxigenic? You will say, ma'am, line आया मतलब toxin है. तो simple. What is LX gel precipitation test? It is done to know the toxigenicity of a bacteria, and simple, if the line comes, the toxin is there. What is the Schick test? S for S. Schick test is done to know the susceptibility of an individual. I'll tell you, it's what? It's an intradermal test. Skin test है, तो susceptibility मतलब that if you see a redness If you end up seeing a redness, matlab if you get to see a positive reaction, this means the person has a risk of having diphtheria. There is susceptibility. And if you see a negative reaction, this means the person is immune. So you just go in the exam and write spin. First, what is positive, what is negative? So simple. If the person is having positive reaction, matlab wo susceptible hai. Negative reaction means he is immune. So repeating, gel precipitation test is done to know whether toxigenicity is there, and Schick is done to know whether there is susceptibility. Finally, guys, on the basis of the growth on which culture media, on the basis of the growth of the selective media, potassium tellurite agar, there is a biotyping of Corynebacterium that is done, and that is learnt as the mnemonic gym. Acha, ek baat batao, people who go to the gym, what are they like always? What is in their head? You will say, ma'am, in their head, they are only talking about protein, protein, protein. Matlab, they are talking about how to eat maximum eggs. Egg, egg, egg. So I have learned, gym mein, the people who go to the gym, in their head, all they think of is egg, egg. Gym mein, in their head, they think of egg, egg. So what is gym? Gravis, intermedius, mitis. Ho gaya yaad? Gravis, intermedius and mitis. These are the biotypes of Corynebacterium. And why did I say head? So head matlab gravis shows you daisy head colonies, and then the others show you some egg, egg colony. Frog egg and poached egg. So put it in alphabetical order. Frog egg will come first, poached egg will come later. Simple. So remember, gravis, intermedius, mitis shows you the daisy head colonies, the frog egg colonies and the poached egg colonies. Also, which of them is looking mitis? Minimal infection karayega, least virulent. Mitis is gonna cause minimal infection. That is how I have learnt it. ठीक है, mnemonic clear. Now gravis, which of them is going to be? देखो, gym जाने वाले के लिए, if someone who goes to the gym, what is grave? What is मतलब deadly for him? Ma'am, consumption of carbohydrate. Carbohydrates is like big no. He is only thinking about protein. He cannot think about carbohydrates. So grave क्या होगा? Something to do with carbohydrates, starch fermentation. Gravis is going to show you starch fermentation. So 1 property हो गया ना. Mitis is going to show you minimal वाला infection. Grave क्या होगा? Starch, carbohydrate. And lastly, if I ask you which of them is going to be non-hemolytic, whatever is left, intermedius is non-hemolytic. ठीक है, 1 feature is done for all of these. How are you going to treat all of these? I think all of you know that Corynebacterium diphtheria is a droplet infection. So this means all the droplet precautions have to be taken, no matter whichever, cutaneous hai, pharyngeal hai, respiratory hai, systemic hai, any kind of diphtheria, droplet precaution has to be taken. In antibiotics, penicillin or erythromycin is the antibiotic that is given, but the treatment of choice is going to be the diphtheria antitoxin. No matter which kind of infection you might be dealing with, it is the diphtheria antitoxin. The dose is not very important, but you know that if the disease is less than 3 days or pharyngeal or laryngeal, 20 to 40 K units is given. Thoda severe hai, that is nasopharyngeal, 40 to 60 K is given, and if it is very extensive, you can give 80,000 to 1,20,000 units, and that also you divide. That's too much of dosage, na? So you give half IM and half IV. That is what is done for very prolonged diseases or diseases beyond 3 days or diseases which are going to be involving too much of the body, extensive. You give a higher dose, half IM, half IV. So antitoxin is the primary stay. Antibiotics are given, penicillin or erythromycin, and till the time the person is cured, droplet infection ka precaution lena hai. Okay, all of this was to do with Corynebacterium diphtheria, but I also told you we'll be discussing the other Corynebacteria other than diphtheria. So please note over here, we have some of these which are going to be non-lipophilic. Okay, these are the ones which are going to be non-lipophilic. What all do we have? Corynebacterium ulcerans. U is going to be for ulcer and L is going to be for it causes involvement of the lungs. There is lung involvement that is noted over here. Coming to Corynebacterium pseudotuberculosis, P is going to be for the other name that it has, that is Presnocard bacillus, and S is going to be that it doesn't cause infection in us. S matlab it causes infection in sheep. So what have I done? First alphabet, second alphabet. Ulcerans ka U was for ulcer, L is for lungs. Pseudotuberculosis ka P for Presnocard bacillus, S is for sheep. And finally, Corynebacterium minutissimum basically causes erythrasma. Have you heard about this in dermatology? Yes, erythrasma is erythro, matlab it's a red color rash, and it is going to give give what, guys? It is going to give a coral fluorescence on wood lamp examination. You have read about this definitely in your dermatology. On wood lamp examination, it gives a coral red fluorescence. So how I have learnt it is कि देखने में भी it is red in color, and on wood lamp examination also it gives a coral red color on the wood lamp examination. ठीक है, चलो. Now coming to, these were all non-lipophilic. So now I will ask you which are the ones which are going to be lipophilic, and those are going to be Jacium as well as Urea liticum. अब urea वाला तो anything is always going to cause one stone in the kidney, and that is the struvite stone. Remember Staghorn calculus, struvite stone is always related with urea. So tell me, any other organism which is also urease produces and causing this struvite stone? That is Proteus. Proteus reminds us of urease, so that is also urease producing, and Urea liticum is also urease producing. So these all cause struvite stones. What is Jacium? Jacium is going to cause prosthetic heart valve endocarditis. Both of these are previous year questions. Urea liticum for stones and Jacium is going to cause heart valve endocarditis. They are both lipophilic. Others are all non-lipophilic. Yes, on that note, we have finished off the Corynebacterium, diphtheria and the diphtheroids under these gram-positive bacilli. We are now going to go on to the next family that we have, and that is Bacillus anthracis and Clostridium species. Means I'm going to start off with the spore-forming organisms. So let's begin with the spore-forming organisms, and that includes the Bacillus as well as the Clostridium. Now, I hope you remember that Bacillus happens to belong to the obligate aerobe family, that it will grow in the presence of oxygen, and Clostridium is the opposite, that it is an obligate anaerobe, that it will not require any oxygen. And if both of them are spore-forming organisms, so let me draw the two organisms for you. In which of them is there going to be a bulging spore, means it's coming out of the boundaries, and in which of them there is a non-bulging spore? So remember, B is not for B. Means when I say Bacillus, it cannot have bulging spore. So B is not for B. It is going to have a non-bulging spore, whereas Clostridium is going to have a bulging spore. So repeating, Bacillus non-bulging and Clostridium bulging spores. That is what is a spore forming organism. Let us begin with Bacillus, and you know the main one is Bacillus anthracis, and everything about Bacillus anthracis is quite different from the others. So does it have a capsule? Yes, but this capsule is different because it is a polypeptide capsule, polypeptide which is made up of polyglutamate. I hope you remember we had studied in general microbiology that all the capsules are usually made up of polysaccharides, right? However, this happens to be an exception where the capsule is made up of polypeptides. Second, every bacteria has a toxin. This also has an anthrax toxin, but we had studied all the toxins are going to be bipartite. They contain two parts. However, we finally have anthrax toxin, which is an exception again, which is tripartite, and we have learnt it as English Premier League, EPL, means edema factor. Edema factor means what? What does it increase? It increases cyclic AMP. Okay, what is P? Protective factor. It's going to protect us, right? It's going to protect us by attaching to us. And finally, L for lethal. Lethal means death. It is going to cause death. So repeating, edema factor, protective factor, lethal factor. So if someone asks you what is the mechanism of action of the anthrax toxin, you will say, I have found the cyclin, I found the cyclase enzyme, adenylate cyclase, that is cyclic AMP is elevated. I will be giving you a list of all the cyclic AMP, GMP in a while. Abhi ke liye learn, it is going to be cyclic AMP. So now what is going to happen? This is a bioterrorism agent. I hope you know bioterrorism category A agent, and what are the different types of anthrax. So this is going to be something coming from the animals to the humans. So what are the different methods by which it can come? Number one is going to be a skin to skin contact. So what is it known as? Hyde-Porter's disease. Hyde matlab, Hyde is animal skin. And porter, we all know, someone like a coolie is a porter who picks up all the animal skin on his shoulder, and so big bundles of animal skin are picked on his shoulder and his neck. So can you see what has he developed over here? He has developed a malignant pustule or malignant eschar. Why am I calling it malignant? It's not a cancer. Malignant because look at the color. It's so scary looking. It's black in color. Why is it over here? Because the big bundles are lifted on the shoulder and the neck. That is a cutaneous form, Hyde-Porter's disease. However, someone working in the wool industry will be inhaling the wool fibers. Then what is the kind of anthrax that will occur? Pulmonary anthrax. So what does it cause in the lungs? Actually, rather than pneumonia in the lungs, it causes hemorrhagic mediastinitis. So this is what is very commonly seen, and obviously this is the form that is associated with bioterrorism, because bioterrorism means it will spread very, very quickly, and inhalation is the best way to spread something very quickly, as we have seen with COVID also. Okay, coming to the next, intestinal anthrax. This is obviously by eating something. So if someone ends up eating undercooked meat will go to the GIT, means there is intestinal. What in the intestine? Hemorrhagic enteritis. So overall you realize everything is hemorrhagic. Skin mein hua to hemorrhagic black color, pulmonary hemorrhagic mediastinitis, GIT hemorrhagic enteritis. So yes, wherever there will be a disease, the hemorrhagic word will definitely come up over here. So now asking you, what are the culture characteristics? I've again tried to make 1 or 2 collage stories and finish it off that way. So firstly, when I look at a sample under the microscope, this is a picture that came in the recent exam of FMG and NEET. I can very well see that yes, there are some boxes. And why is there a white area in the center? Because this area is the spore. So why is that white? Because I have studied that spore does not pick up the gram stain. That is why it is white over here. So what is this appearance known as? Bamboo stick or boxcar appearance. Remember, Bacillus anthracis. Bacillus anthracis is going to be showing you the B and the A, that is the bamboo stick appearance or the boxcar appearance. Now look at all these findings on a blood agar. Kya dikh raha hai? I can see that this appearance is looking like a frosted glass, hai na? Like you've seen frosted glass in winters, that kind of a frosted glass appearance. Then over here, if I see the next one is, it's looking as if a tail is coming out. So that is the comet tail appearance. The next one, it looks as if I'm beating egg. When you beat egg, these strands come out. So that is the beaten egg appearance. Ye sab dikhta hai. You see frosted glass, comet tail and beaten egg appearance. But if you ever go very close to them with a lens, you will see that they are all aisa wavy. They are all going to show you the Medusa head appearance. So remember, bamboo stick, frosted glass, comet tail, beaten egg and Medusa head is the same. They are all going to be seen in Bacillus anthracis. What do you see when I change? You'll say, ma'am, ye bhi blood agar lag raha hai, but I have added something over here. I have added penicillin. So remember, if I add PE penicillin, now the anthrax will start looking like PE pearls. It will now start looking like string of pearls. So remember, if there is a PE penicillin agar, there is PE pearls appearance that you see. Finally, what is this test tube shown over here? This is a gelatin stab appearance. Guys, this is a gelatin stab, and what kind of an appearance do you see? We see the inverted fir tree appearance. So quickly tell me, whenever they will talk about a gelatin wala technique, either they will show you an inverted fir tree appearance, or they will show you a tree appearance, or they will show you a turnip appearance. Quickly tell me. Inverted fir tree. If they say inverted fir tree, I've already got the organism in front of me, that is Bacillus anthrax. If they make it a Seedha tree, if they say no, this is looking like a simple fir tree, you will say tree for T, that is tetani. That is seen in Clostridium tetani. So remember, Seedha tree is seen in tree tetani. Okay. And finally, if they say it's looking like a turnip, okay, turnip is like a vegetable. So vegetable I will want to combine with rice. Rice and vegetable ka combination, which is the organism that shows you rice water stools, Vibrio cholera. These are the 3 gelatin appearances that you can see. Quickly repeating, if we see inverted fir tree, the tree has become ulta, gir gaya tree, that is Bacillus anthrax, because anthrax is very deadly. So tree gir gaya, theek hai. Now when we see simple tree, so tree for tetany, Clostridium tetany. And when I see the turnip, or instead of calling it turnip, because turnip will sound a little weird, na, they will call it napiform. Napiform or turnip liquefaction, that is seen turnip with rice water, so that is going to be Vibrio cholera. These are the different gelatin appearances. Coming back to Bacillus anthracis, what are the things that are left? Do you know what is the selective media that you have? There's a selective media called PLET. So PLET media is the selective media that we have. And other than that, A for A. If you want to know the antibody, ELISA to har jagah karte hain, but what is very important over here, for anthrax we do the A for A, Ascoli's ring precipitin test. No one does it, but MCQ aata hai. Ascoli's ring precipitin test is for anthrax. How are you going to treat it? If it is an uncomplicated cutaneous disorder, that is, the Hyde-Porter's disease, or that eschar is formed, you're going to give antibiotics. That could be ciprofloxacin or doxycycline for 7 to 10 days. We are also adding sometimes, other than skin, there is systemic involvement. You can add an antitoxin because the toxin is creating a problem. So you add an antitoxin, or you can also add a kind of monoclonal antibody. How will I learn it? So remember, we have ulta padna. Bacillus anthrax. So Bacillus anthracis. So raxibacumab, monoclonal antibody Bacillus anthracis के लिए use होता है. On the other hand, if there is CNS involvement, I hope you all know there is a 60-day antibiotic regime that is followed. What is 60-day antibiotic? We have the same ciprofloxacin that we have, but we've added meropenem and clindamycin, and that is going to be given for 60 days. Also, post-exposure prophylaxis, coming in contact with some animals, especially vets, professionals, they can come in contact with some animals. What are you going to do? Antibiotic to same rahega. The same 60-day antibiotic will go on. However, you will also add the Biothrax, Ava Biothrax. What is Ava Biothrax? It is Biothrax matlab the vaccine. Bacillus anthrax, Biothrax, anthrax ka vaccine will also be given for post-exposure prophylaxis. Anthracis is okay. What are the other bacilli that you have to know? Bacillus cereus. Where have I taught you Bacillus cereus earlier? It was causing the food poisoning, and it was causing that very short incubation wala food poisoning. Staph aureus se related. Yes. Now I recall, Bacillus cereus was confused with Staph aureus. What was common in between them? Dono ka jo incubation period tha was less than 6 hours. So yes, if there is vomiting that has been mentioned, incubation period is less than 6 hours, and I told you C for C. I told you that is because of the Chinese fried rice that is being consumed. It is because of the Chinese fried rice. Kyun hota hai? What is increased? It is going to be an increase in the cyclic GMP that you notice. I'll give you a beautiful mnemonic over here. Okay, it's going to be an increase in cyclic GMP. And what kind of a food poisoning is it? Patient will constantly be vomiting. So that is what you had confused with Staph aureus, because Staph aureus may be the same incubation period is there and you have the same vomiting happening, but what was different is Staph aureus was not because of Chinese fried rice. Staph aureus kyun tha guys? Because of milk and poultry. Okay, so this much information is clear. But Bacillus cereus causes one more type of food poisoning, that is the diarrhea wala. Ab socho, when food goes into your stomach, food poisoning hua. Is it shorter time to come out through the vomiting? So through the vomiting, so it came out jaldi. But when it has to come out through the stools, it's going to have a longer incubation period. Zyada travel karna hai na, so it's got a longer incubation period of 8 to 16 hours, and that is the milk and meat that I'm talking about. So milk and meat comes over there, and the mechanism is going to be increase in cyclic AMP. How do I learn where is AMP and where is GMP? So see, when you're talking about vomiting kahan se karte ho? Ma'am, vomiting gale se karte hain. Right, so gala will remind me that okay, gale se vomiting kara, so that is going to be cyclic GMP. And diarrhea kahan se hota hai? Anal canal se hota hai. So diarrhea is going to be from anal canal. So what is the cyclic AMP? So anal canal wala diarrhea wala cyclic AMP, gale wala cyclic GMP, and you know it's a shorter time to come out in the vomiting and a longer time is going to take in coming out through the diarrhea. This is okay. Please note, how is Bacillus cereus different from that anthrax? Anthrax had a capsule. This is not going to have any capsule, and anthrax was not moving around. This has no motility. Bacillus cereus is motile. You will have to remember Bacillus cereus as one of a very serious politicians whom we had. I will not name the politician, but I will give you a hint and maybe you can Google and find out. So we have a very serious politician, a very serious politician, and she conducts a lot of rallies and she's constantly moving. So I've given you a hint. She is constantly moving, so she is definitely motile. So remember, serious for Bacillus cereus, motile because it's a motile organism. And there was a very famous social media hype that was created 2 years ago when in a rally she started saying words like rumba rumba. If you remember, there was one politician who randomly, that did not make any any articulated word. It wasn't any articulated word, but she started saying words like rumba rumba, and that is how I have learned that the serious politician who was very motile and used to move around started saying rumba rumba matlab maipa pemba. What are gonna be its selective media? It is maipa pemba. You don't have to know the full form, but M in both the places stands for mannitol. And yes, the Y is going to be associated with yolk. So that is going to be present. P common hai, so polymyxin again. So basic you should know, but MIPA PEMBA पूछा जाएगा, ठीक है? So remember that serious politician who roams around a lot started saying rumba. So now you can, you know, humba rumba, these are the kind of things she started saying in her rally. You can Google and find out. So you will always remember serious politician, MIPA PEMBA. Okay, Bacillus cereus is done. Bacillus is over. What can I move on to next? I can go on to the Clostridium family. Before I go on to the Clostridium family, they are also spore forming. Hai na? They are spore forming. So now you will ask me, what is the most common location of a spore? The most common location is subterminal. Subterminal means, look at this. It is just behind the terminal end. This is the terminal end and the spore is just beneath it. Subterminal is most common. So where is it going to be? Terminal. Remember, TE for terminal, TE is going to be for tetani, TE for tertium. So TE, you can see na TE, terminal spores over here. Remember, tetani is going to be known as the drumstick appearance and tertium is going to be known as the tennis racket appearance. How do I differentiate between the two? So draw karke dekh lo. The drumstick is going to be, one end is round. Drumstick aisa round hota hai. So the spore is going to be round. Whereas if I draw a tennis racket looks something like this. Basically, the tennis racket is going to be oval. So now I'll zoom in and I'll ask you, compare karo. Look at this one. You will say, ma'am, over here, there is a round appearance. So ye tetani hoga, drumstick. Whereas over here, there's an oval appearance. Ye tennis racket lag raha hai. Tennis racket matlab tertium. Please don't forget in the exam, what is drumstick, what is tertium, or what is tennis racket, because when you say TER for tennis racket, you say TER for tertium. Tennis racket is tertium and drumstick is tetani. So remember, terminal, tetani, tertium, tennis racket. Okay. Now we say, where is it central? Can you see exactly in the center over here? There are two organisms. One is going to be that Bacillus cereus wala only, because CE for central, CE for cereus, and Clostridium bifermentans. Guys, bifermentans beings, because whenever something is in the center, it has divided the organism in bi parts, two parts. So central wala is for cereus and for bifermentans. That is very important. Ho gaya spores clear? Most common subterminal. Terminal में TE and central में CE and bifermentans. Now let's come to the Clostridium species. Giving you rules for the Clostridium species. Please note that Clostridium is usually, before that, tell me, what are the subjects that you took for getting into NEET UG? You took physics, chemistry, bio, right? Most of us. Because which exam did you have to crack? You had to crack PMT. You had to crack, kill PMT. So I'm going to kill PMT over here. Okay, mnemonic banana aa gaya. I took physics, chemistry, bio, and then some extra smart people like me took maths also for God knows what reason. They thought we'll do what, we cannot survive without maths, although it was not at all needed. You could do only by keeping PCB also. So physics, chemistry, bio liya. Why? Because you want to kill what? You wanted to kill PMT. Now listen to me. Most of the Clostridia are unencapsulated. However, which are the ones which are C for capsulated? Which are the ones which are C for capsulated? You will say, ma'am, P and B. That means we have perfringens and butyricum. Perfringens and butyricum are going to be capsulated. Ho gaya simple. Which are the ones which are capsulated? Perfringens and butyricum. Okay, then I say that all of the Clostridia are going to be motile, except which are the ones which are non-motile. Ab dekho, kill the PMT. Which are the ones which are non-motile? Again, P and T. P and T are going to be non-motile. That means perfringens and tetani. Tetani kaun sa? Tetani 6. So remember this, guys. Perfringens and tetani are non-motile. Perfringens and butyricum are capsulated. So PCB, to kill the PMT, is what I learn. Now let's start one by one. Let us start with this perfringens, because ye har jagah hi exception mein hai. This is the one that has a capsule. This is the one that is not going to be motile. So what does it cause, guys? It's one of the most common causes of gas gangrene. Two questions in front of you. What is gas gangrene? So you can see that gangrene always will mean that the area has become very, very black. I can see there is a discoloration, death of the area happening. But so I can see, the tissue is dying. There is necrotic tissue. So I can see a lot of discharge happening. However, what is gas over here? The gas production means that gas will create bubbles. So if you touch that tissue, it will have that crackling sound known as crepitus. Also, the patient comes to you with a lot of pain. That is the meaning of gas gangrene. But why did I say the most common cause? Because remember PSN. What is PSN? Means gas gangrene is caused by P for perfringens, S is going to be for septicum, and C is going to be, or N is going to be for Clostridium novi. These are the other organisms which can cause. So remember, gas gangrene again caused by perfringens, septicum and novi, out of which I want you to know septicum, SS wala sound. Septicum organism shows you a very famous body called the citron body. Septicum shows you the citron body. ठीक है. Now what is the treatment going to be, ma'am? Tissue तो dead हो गया है, तो remove it. Simple. There is gonna be surgical debridement. Number 1. Number 2, I realize that it is an infection. I will have to give antibiotics. Okay, give IV penicillin and clindamycin for 2 weeks approx. So surgery kara, give antibiotics. But one more thing. The first thing I told you was Clostridium works best in anaerobic situation. Anaerobiasis. तो बेस्ट इज कि इसको ऑक्सीजन दे दो, गिव लॉट्स ऑफ ऑक्सीजन एंड देन दिस ऑर्गेनिज्म विल से आई एम नॉट वर्किंग. सो व्हाट आर यू गोना डू? Hyperbaric oxygen therapy is also what you have to consider. So repeating, you're going to do surgery, you're going to give antibiotics, and you're going to give hyperbaric oxygen. Let's move forward. How is this the only thing that Clostridium perfringens causes? Gas gangrene? Nahi. It can also affect our intestine. Guys, it can cause food poisoning because of warmed or cold food which has been warmed up. That kind of food is what is going to be causing food poisoning with Clostridium perfringens. It can go and cause necrosis in the intestine, necrotizing enteritis, necrotizing appendicitis. This is a previous year question in the FMG exams, by the way. Necrotizing enteritis, and everyone feels enteritis है तो कोई GIT वाला organism होगा. Not many people think of perfringens. You have to know perfringens causes necrotizing enteritis. Okay, there is a very famous perfringens causes pig bell. What is pig bell? So now listen to all the P means that when I'm talking about perfringens, it causes a special type of food poisoning called pig bell. Pig bell में क्या होता है? There is consumption of pork combined with what? Potato. कौन सा potato? Sweet potato. ठीक है, there is consumption of pork combined with sweet potato. So remember P. Perfringens causes pig bell, consumption of pork and sweet potato. If you have to treat pig bell, you will have to give IV penicillin plus metronidazole. Everyone's clear? तो अब food poisoning वाला एक पूरा story हो गया, pig bell, gas gangrene वाला पूरा story हो गया. Now let me come to the lab diagnosis. There is a very, very famous media called Robertson's cooked meat broth. I hope you remember. Whenever we have to go in for any anaerobic organism, we are going to do Robertson's cooked meat broth. So tell me one thing, that if I say I told you one mnemonic in general micro. Let's see if you remember. You had to write my name, and from my name you had to pick up the mnemonic. And first, my favorite color. So my favorite color is pink. ठीक है? So now so many things about me you will unnecessarily have to learn because you have to make mnemonics. And I always make sure that the day I have to teach you this mnemonic, I'm wearing something pink so that you even have that visual memory. Even if you go to the main videos, the day I have taught you this mnemonic in the main videos, I also made sure I had some pink things so that your visual memory works. Anyway, so when I say pre, you will remember perfringens. Means you will say that on Robertson's cooked meat broth, Clostridium perfringens gives what color? It gives a pink color. What reaction is that known as? That is known as a saccharolytic reaction. So simple. Preeti for perfringens. S is going to remind you for saccharolytic reaction, and the color that ma'am likes is pink. So the color that you get is a pinkish color over here. So remember, that is what you get with Clostridium perfringens. Beyond that, we had a very famous mnemonic that is known as senior NTR. Clostridium perfringens causes, or is going to show senior NTR. What is senior NTR? Directly let us look at the pictures. Collage hai hamare paas. So senior NTR mein what is S? We have stormy clot. On what? On litmus milk. They will show you some kind of litmus milk, and they will show you there is, can you see a lot of bubbles that are created as a storm jaisa appearance hai? So stormy clot appearance on litmus milk. So senior NTR ka senior is done. What is N, T and R? N for Nagler's reaction. What is Nagler's reaction? The question that you get is what plate has been used? You have used an agar with egg yolk. So I have used an egg yolk agar. And tell me something, can you see in an egg yolk agar there is an opaque area that is noted? Why is that noted? Because Clostridium perfringens has a toxin called alpha toxin. And alpha toxin ka dusra naam they will really ask you. That is known as lecithinase. That is referred to as lecithinase. Please note that why am I talking about it over here? Because egg yolk has a lot of lecithin. Over here, there is a lot of lecithin present because the egg yolk hai na, there is too much of lecithin. And if I will add Clostridium perfringens, that lecithin will be broken because Clostridium perfringens will get lecithinase along with it. And that is the reason the lecithin will be broken and this area will all become opaque. That is known as the Naegler's reaction. So that means that it is because of alpha toxin. Toxin ka property hai ye. Ma'am, this means other side of the culture media, if you add an antitoxin, so nothing will be seen. That toxin will not be able to work. So over here, the alpha toxin could work. Over here, it could create an opaque area. Over here, you had been acted smart. You had added antitoxin. So do you see any opaque area over here? You do not. And that is known as the Naegler's reaction. So please note, Naegler's reaction is because of which toxin? Ye question aata hai. That is alpha toxin. What is the other name of alpha toxin? It is also known as lecithinase. What is NT? T stands for target hemolysis. Now, what is this target hemolysis that you see? You can see one zone and two zone. You can see a double zone of hemolysis. So please remember, the inner one is because of which toxin? It is because of theta toxin, and the outer one is because of the alpha toxin. ठीक है, so inner one is theta toxin and outer one is going to be alpha toxin. Alpha comes first, so basically alpha bahar hai, predominant kar raha hai, and the inner one is going to be the theta toxin. Okay, senior NTR. Now I come to reverse camp test. First and foremost, you will have to recall for me, where was camp test? Gala time in a camp, agalacti, streptococcus agalacti, gala time in a camp it was causing, है ना? So camp test was seen there. तो उसमें क्या करा था? जल्दी से make some diagram for me. Over here, ma'am, you say the ऐसा horizontal वाला line was agalacti. So in reverse camp test, over here also the horizontal wala line is agalacti. This means ये vertical wala line is gonna change. In the camp test, देखो camp में A पहले आ रहा है, so you are gonna use staph aureus over here. Camp में A आता है, तो we use staph aureus. Whereas reverse camp में you will think of perfringens. Reverse में you will think of perfringens. So what you have on this line is perfringens. So simple. I realize camp and reverse camp में क्या difference है? दोनों में the horizontal line is going to be agalacti. That is same. The vertical line is going to make a difference. So in camp test, the vertical line is going to be staph aureus, and in reverse camp test, the vertical line is going to be Clostridium perfringens. That wraps up our senior NTR. Stomy clot appearance, Naegler, target, and reverse camp test. And I've told you anaerobic media, Robertson's cooked meat broth. Now we are done with this. We can move on to the next topic, and that is the next organism, Clostridium, everyone's favorite, Clostridium tetani. And no points for guessing that tetanus matlab there is gonna be a lot of muscle spasms that we notice over here. So firstly, please let me tell you, this muscle spasm is going to be because of what? Let me ask you, is it because of tetnolysin or tetnospasmin? So you will say it is because of, ma'am, you're using the word spasm, it must be because of tetnospasmin, because we have two of the things which tetanus releases. Tetanus releases tetnospasmin and tetnolysin, out of which remember OS and OL. Tetnospasmin is going to be oxygen stable, tetnolysin is going to be oxygen labile. That is a question that you get. क्यों? Because both of them are going to be heat labile. देखो heat labile तो दोनों है, so I can't really differentiate them on the basis of heat lability. Both of them are heat labile. But now you've got the mnemonic. Tetnospasmin is oxygen stable and tetnolysin OL is going to be oxygen labile. And which one do you think is causing spasms? Or of course, it is going to be by the role. The role of muscle spasms is going to be by tetnospasmin. Very famous question. Who causes this? Okay, so which is the first muscle to undergo a spasm? It is going to be the masseter muscle. And if the masseter muscle undergoes a spasm, this means the patient is going to have a locked jaw. He will not be able to open his mouth. So there is going to be trismus. Other than that, look at these complications. You know this bow wala position that the patient has, and that is known as the opisthotonous position. And then you know the patient looks as if he's smiling. Sardonicus, sarcastic smile. It looks he's smiling, but he's not smiling. Only his face is looking like that, because yahan ka muscle, all the muscles have spasmed out like that. So it's pulling the lips and it looks as if he's smiling, but he's not. Okay? So that is the thing that you have to know with Clostridium tetani. Now you will ask me, obviously, its mechanism of action. So have a look at this picture over here, which will help you a lot. See, this same picture, one side of this picture I will explain right now for Clostridium tetani, and in 5 minutes I will explain the same picture on the other side for Clostridium botulinum. In Clostridium tetani, what do we see? That whenever, see, tetanus kaise hota hai? Koi injury se hota hai na? Of course, it is a wound related infection. So it is because of some injury this happened, and then the organism has traveled to which neurons? It has traveled to the inhibitory neurons. Question number 1. Clostridium tetani is a problem in inhibitory neurons. You know what these neurons have? Inhibitory neurons के vesicle में क्या है? Ma'am, the inhibitory neurons in their vesicle have something called GABA and glycine. And if you want, inhibitory मतलब will they allow the muscle to relax? They are, see, two things. If I have to ask you, excitatory neuron क्या करेगा? You will say, ma'am, it will excite. It will make the muscle contract. How? Because it releases acetylcholine. What does inhibitory neuron release? Inhibitory neuron will make the muscle relax. So it is going to release GABA and glycine. तो सिंपल, यहाँ से होगा contraction and यहाँ से होगा relaxation. That is how I explain this single diagram for 2-3 diseases. So now I'm saying that if you want to release GABA glycine or if you want to release acetylcholine, it is important that if I zoom in, ये vesicle में अगर zoom in करें, you will see that it is important that these molecules are going to, ये जितने भी snip, snap, syn वाले molecules है ना, they have to fuse. So what are these known as? These are all known as the snare proteins. So it is important that the synaptobrevin, syntaxin, SNAP25, all of them should fuse. If there will be fusion, only then all of these GABA, glycine, acetylcholine release hoga. So now tell me that this is not allowed by Clostridium tetani. What does Clostridium tetani do? It is gonna act presynaptically at which membrane? At which neuron? Inhibitory wala neuron. What will it allow? Will it allow GABA glycine to get released? No, ma'am. So please note that this Clostridium tetani shall not let this fusion happen. ये जो fusion होना था and then GABA glycine had to be released, it will not let that happen. GABA glycine will not release. If GABA glycine will not release, no relaxation will occur. See, contraction होता जा रहा है. That is why contraction होता जा रहा है. Relaxation is not occurring, and that is the reason that it results in muscle spasms. So please repeat, where does it act? It acts presynaptically at which neuron? Presynaptically at the inhibitory neuron terminal. The same effect can be seen with strychnine poisoning. Strychnine poisoning also results in all these tetanus jaisa spasms, but the same effect, GABA, glycine, sab kuch same, but it is gonna act at what level? It acts postsynaptically, whereas tetanus is gonna act presynaptically. I hope everyone's okay, because I can move on and make you study the lab diagnosis. Clostridium tetani, I've already told you, it shows you the drumstick appearance. If it is drumstick appearance, that means there is TE for tetani, terminal. I can see, yes, the round. These are all the drumstick appearance that I notice in the spores. Then I told you any anaerobic organism, Robertson's cooked meat broth. You'll say, hang on, ma'am. Right now you told me a mnemonic with your name, Preeti Sharma, pink. तो परफ्रिंजेंस में पिंक कलर था, मतलब टेटनाई में ब्लैक कलर है. And Preeti Sharma, perfringens had saccharolytic reaction. So tetani is going to have proteolytic reaction. Simple na? So now you know perfringens had saccharolytic and pink. Tetanus has proteolytic and black reaction. And tetanus shows you something called swarming, the round and round concentric motility. I'll be telling you in a while what all organisms show you swarming. PVC is mnemonic, hai na? Now coming to the gelatin stab. This I've already told you. For tree, जहाँ T था, वहाँ we are gonna say tetany. Tetany shows you tree, and गिरा हुआ tree, that bioterrorism वाला deadly agent which has made the tree fall off, Bacillus anthracis shows you inverted fir tree, whereas Clostridium tetani shows you tree appearance, सीधा tree. Okay, this was about Clostridium tetani, because now I'm gonna tell you Clostridium botulinum, but this is already clear to me. Botulinum क्या करता है? Botulinum is gonna go and act on the excitatory neurons. Same thing. The synaptobrevin, the SNAP25 and the syntaxin, these are the things which are not allowed to fuse. If they will not fuse, excitatory neuron क्या release करता है guys? Excitatory neuron was supposed to release acetylcholine, but all those syn snare proteins had to fuse. वो नहीं हुआ. This means there is no acetylcholine release. This means there is no contraction. So now this time ulta, contraction is not happening, But from this side, GABA and glycine are definitely coming and they are causing relaxation. So now you'll say, ma'am, all your muscles are just relaxed because there is no one to contract it. मतलब सब कुछ ऐसा flaccid. So opposite हो गया ना. If I compare the two, when I was talking about tetany was active on the inhibitory neuron. So everything was becoming very, very tense. Tetanus में सब कुछ tense था. Whereas Clostridium botulinum में it is acting on the excitatory neurons and inhibiting it. तो सब कुछ बिल्कुल ऐसा flaccid हो गया. What are the different types of Clostridium botulinum that you have? The food borne. In fact, that is how I've always learned botulism. Botulism is bottled and canned food. Botulinum is bottled and canned food. So if you ever consume canned food, you're at a risk of food-borne botulism, right? And kya hota hai? Everything is D. There are a lot of D's that is happening. So you will say number 1, diplopia, dysphagia, dysarthria, descending flaccid paralysis. Why? Because इसमें सब कुछ ऐसा मैम flaccid, just relaxed state. Because acetylcholine release has not occurred, contraction is not going to occur. So सब कुछ flaccid, descending flaccid paralysis, and there are dilated pupils. So repeating, diplopia, dysphagia, dysarthria, descending flaccid paralysis, and dilated pupil. That is one thing if there is consumption of canned bottled food. Similarly, बच्चे को अगर दे दिया, if you give the बच्चा some bottled food, for example, some baby food or honey, there's a tradition in many states where as soon as the kid is born, they make the kid lick honey. Very, very dangerous. So bottle feed, honey, baby food, if these are given, the kid can be exposed to bottled food wala botulism. The first symptom is what? The first symptom is, very famous question, it is constipation. And what do you think the child is going to become? ऐसे बिल्कुल relaxed. Ma'am, that is known as the floppy baby syndrome. That is known as floppy baby syndrome. So simply, food and bottled and canned food wala have studied. Other than that, it can be associated with wound botulism. And wound botulism के अलावा, it can come through surgeries, that is iatrogenic botulism. These are the other routes. Botulism okay with everyone, because the last Clostridium that we have is the Clostridium difficile, which is also known as Clostridioides difficile. That's a new name given to it. And we all know that it causes a disease called PMEC, pseudomembranous enterocolitis. Very, very important in medicine and surgery also. So I've got you one final flashcard for it before. Yes, this is what all you have to know for pseudomembranous enterocolitis. So first and foremost, what is the organism? Clostridioides difficile. Okay, so what are the toxins that it has? Ma'am, it has a toxin A and it has a toxin B. Toxin A will go and firstly tell you, toxin A will say, oh, that is the intestine, that is where I have to go and that is where I have to attach. Whereas toxin B will say, okay, attach ho gaya, kill it. Simple. Toxin A is the guiding light. It is the guiding light. It is taking the bacteria towards the intestine and saying, okay, please attach over here. Toxin B is cytotoxin. It's going to kill the cells. Once it kills the cells, you can very well see that all these cells are getting killed. ये देख रहे हो, एक volcano-like eruption हुआ है. What you're seeing over here is one of the most beautiful pictures known as a volcano eruption, because volcano eruption is nothing but the dead necrotic cells that are present. Who has killed them? These toxins have killed them. And imagine once volcano, देखो volcano eruption you've seen in movies and all, na? Once the volcano erupts, all the lava will come and settle eventually over here. So can you see this dirty membrane formed over here? This is said to be a pseudo membrane. And which part of the intestine does it settle on? It settles अंदर की तरफ. It is a mucosal membrane. That is a question that you get. It is a mucosal membrane. So now you have learned that there are two toxins which come. They destroy everything. There is a volcano-like eruption that happens. When the lava settles down, it makes a dirty yellow membrane called pseudomembrane on the mucosa. But हुआ क्यों? हुआ because of Clostridium difficile. Again asking you, हुआ क्यों? Because whenever the patient is on long-term usage of antibiotics, which you'll see a lot in our country, because you will say the patient has to take cephalosporins for 1 week and he will continue taking it for 2 months and consider it like a vitamin tablet, or for whatever clinical reasons you have to give the patient antibiotics for a prolonged time. So after that long-term usage, the person's gut flora changes, and that is when Clostridium difficile infection can occur. Patient will come to you with watery diarrhea. So how are you going to do the diagnosis? Either you can do toxin, ma'am, main तो toxin है culprit, तो toxin के लिए ELISA कर लो, toxin के लिए PCR कर लो, find the toxin, or you can do some culture media. So when I say Clostridium difficile, I can see that this has a lot of C wala sounds, Clostridium difficile. So that is going to be CCFA, CCYA are the culture media that I use. So I hope you will not get confused with, many students get confused with Maipa Pemba. That is why I told you Maipa Pemba was that serious politician, suddenly saying Rumba Rumba na. Serious politician, Maipa Pemba. Bacillus cereus is Maipa Pemba culture media. Over here, Clostridium difficile, if I put down the name, Clostridioides, कितना सारा SS वाला sound है, difficile, that is going to be by CCFA and CCYA. I hope you all remember what is going to be the treatment for it. I hope you now know there is a drug called fidaxomicin. Yes, fidaxomicin is basically used for the treatment of at least the mild cases, and of course we otherwise have vancomycin, which is given for the severe cases also. And yeah, that is what wraps up all of your spore forming organisms. What is the next list that we are going to go on to in that gram positive? Remember, we were doing a McDonald's mnemonic, and under that we have finished off the spore forming as well. We now go on to the filamentous organisms, that is Nocardia, Actinomyces, and after that we will also be wrapping up the Listeria portion. End may we will go ahead with Mycobacteria. So let's start with the filamentous organisms, and that includes Nocardia and Actinomyces. So together we are going to do a table about them, but I hope you remember I had told you a mnemonic for Nocardia, and that mnemonic was to do with nature. Nocardia should remind you of nature. What has Mother Nature given us? She's given us oxygen. She's also given us carbon dioxide. There is also soil that is present, but because of our activities, there are some bad elements also in Mother Nature, and that is acid rain. If you know all these points, you know everything about Nocardia. Because if someone asks you what is the natural habitat, it is going to be there in the soil. If someone asks you that is it an aerobic organism, yes, it requires oxygen. Can you use carbon and grow it? Yes, you can. Is it acid fast? Yes, it is. So coming back, when I talk about Nocardia, as I said, oxygen, it is a strict aerobe, and at the same time, it also requires carbon. So if you can give carbon to it by some technique, it will start growing. And you know how do you culture it? You culture it by the paraffin bait technique. What is bait? Bait is what, like food you give to the fish so that you can catch them. So similarly, paraffin is going to be a source of carbon, and that is how you are going to grow Nocardia. So paraffin is used as a source or a bait, and that is how you catch the Nocardia, you make it grow. So oxygen story done, carbon story done. Acid rain will remind you that it is 1% acid fast, that is also done. And soil shall remind you that this is an exogenous organism present in the soil. If you know all these features, it's the complete opposite for Actinomyces, which I'll tell you in a while. But before that, where exactly does Nocardia go? The most common presentation is pulmonary, but usually lymphadenopathy is not there. And if not the lungs, where is it going to go? It's going to go to the brain. The most common extrapulmonary site is going to be the brain. Now let's go and look at a picture that we have for Nocardia. As I told you, Nocardia is a gram-positive filamentous organism. When I say filamentous, I can see that tangled bundle filaments, and gram-positive, I can see the purple color also. Also, this is a gram stain. The same thing if I want to see under a microscope for Zn stain, because I told you it is 1% acid fast. So if I'm talking about the Zn stain, I can very well see over here that it's become red, because Zn stain gives a red color. So everything about Nocardia seems sorted. Now I can go on to Actinomyces. Okay, if Nocardia needed oxygen, Actinomyces does not. It is an anaerobe. If Nocardia was acid fast, Actinomyces will not be. It is non-acid fast. Nocardia was needing soil, but Actinomyces का mnemonic है everything in the mouth. So where is it present? This is an endogenous flora. It is normally present in our mouth. So where is it going to cause infection? Whenever it will cause infection, it will be something in the oral and the cervical region. So please note, most common Actinomyces can be in many places, starting from the jaw to the thorax to the abdomen to the pelvis, everywhere possible. But because it's most commonly in the mouth, the most common location is the jaw, and that is known as oral actinomycosis. Means there is involvement of the oral cavity, cervical lymphadenopathy is there. So lymphadenopathy इसमें होता है. Nocardia had no lymphadenopathy. So one thing I've learned, everything to do with the mouth is going to come out over here. Okay. What is the culture technique? Culture technique is also related to mouth, because it tends to show you the molar tooth colonies on a solid culture media. So have a look at this. What can I say? Actinomyces, the mnemonic is mouth. So firstly, the involvement is going to happen in the mouth, and these are such pretty molar teeth that you can see. molar tooth-like colonies that you see with actinomyces, and that is how I have learnt it. But do you remember, guys, what was the picture of actinomyces that you saw in pathology? I'm integrating it that way also. Again, it is a gram-positive filamentous organism. So what you're going to see is this sun ray appearance. Remember, we used to talk about it, the sun ray appearance, and I can see that beautiful, those purple sun ray appearance happening over here. But at the same time, I can also see a pink layer around it. Yes, can you all appreciate there is a pink layer around it? So first and foremost, gram-positive filaments I saw, but this pink layer is the Splender-Hopley phenomenon. And what is Splender-Hopley phenomenon? It is nothing but the reaction of the antigen and the antibody. It is an antigen-antibody complex that is getting deposited over here. Where else in microbiology have you studied? Other than actinomyces, you have studied it in a fungus that is Sporothrix schenki, isn't it? Yes, sorted. So that is about actinomyces. Coming all the way back, the mnemonic is, it is the opposite of nocardia, and it's everything to do with the mouth. Now let's finally come to the treatment. So what is the treatment for both of these that you have to know? So we will firstly do, sulfonamides are going to be for nocardia, and for actinomyces, you have penicillin. What did I say? Sulfonamides are for nocardia. Snap se yaad karte hain. Sulfonamides are for nocardia, and for actinomyces, you have penicillin. How easy is that? So your gram-positive filamentous organisms are done with just one thing. There is something called Actinomyces israeli. Remember, Actinomyces israeli, II. This is the one that is seen in females who are using intrauterine contraceptive device. This is the one that is seen in or causes pelvic inflammatory disease. So remember, pelvic inflammatory disease and IUCD users may hoga. But what is different is, I told you Actinomyces was non-acid fast. Remember, nocardia was acid fast, but actinomyces was not acid fast. And please remember, Actinomyces israeli can sometimes be acid fast, and that is why I wanted to know about it. The gram-positive filamentous organisms are done. What we move on to next is going to be the Listeria. If you all remember from your main videos, I told you Listeria monocytogenes has a famous mnemonic. What is that? Listeria is Tully, drunk. Listeria is a drunk organism. This is the organism and the mnemonic that you have to know. It is Tully, and if you have a drunk person and you are going to make, how are you going to test whether he is drunk or not? You will tell him that, say, A, B, C, D, E, F, G. I will get to know whether you can say it or are you going to fumble. So you will find out, catch him. So what is this Tully meaning? Tully means that firstly, this shows you tumbling motility. Why? Because it is a flagellated organism. So tumbling kya hota hai? Tumbling means end to end, something like falling like a drunk man. That is why I called it Tully, because it's to do with tumbling like a drunk man, and it is tumbling at 25 degrees, but it is not gonna tumble at 37 degrees, and that is because this flagella that you are seeing, F for flagella, this flagella that you are seeing is gonna be forming at 25, not at 37. So how we had learnt it in our videos was, main course was that drunk. You can afford to be drunk in your young youth, 25 years of age, but as you grow old, your body and your liver is really going to give up, right? So at the age of 25, this Listeria is drunk, but at the age of 37, he is not drunk. That is how we learnt it. So Tully and flagella is done. If I have to do an animal testing, what is it going to be? So now we move on to the next one. So A is going to stand for the Antin test. What is Antin test? Antin test is going to be that in an animal, you will see if you inject. So in an animal, if I give an injection of Listeria monocytogenes, I will see the presence of keratoconjunctivitis. Keratoconjunctivitis in the animal will be noted. So that animal wala test is the Antin test. Okay. B stands for what? It shows you beta hemolysis. It is showing you beta hemolysis. Let's start with the C and D. How do you get it? What does it cause? So please remember, C stands for, you are going to get it via contact, number one, or contaminated food. And you know which food is very commonly seen to cause it? Cheese, soft cheese, dairy products. So remember, this can occur by contact, by C for contact, C for contaminated food, C for cheese ka history is important. And what else with C? So before I come to that, whenever you have any of this contact or contaminated food or cheese, D for what? Patient is going to have D for diarrhea. So this is a diarrhea producing organism. So how are you going to do the diagnosis? You will say, ma'am, for the diagnosis, E for sabse pehle to let me do ELISA. Okay, I will do ELISA, but I can see a couple of other tests also mentioned. C for which enzyme? Catalase positive. C for CAMP positive, and C for cold enrichment. So catalase positive to theek hai. CAMP positive. Was there any other organism that was CAMP positive? Streptococcus agalacti. So gala time in the camp, and now in the camp, drinking also. So drinking and tully and gala time in the camp. That is how you're going to learn it. So repeating once again, when you're talking about the camp test, you're going to have Streptococcus agalacti, because I said gala time in the camp, and gala time in the camp matlab drinking away, tully. That is going to be Listeria monocytogenes. Camp test. Whereas guys, quick revision, where did you see the reverse camp test? And that was seen in Clostridium perfringens. Now your camp story is done. Okay, moving forward. So what is camp test? You have done catalase positive ho gaya. C for cold enrichment. Cold enrichment means it will grow at a normal temperature, but at 4 degrees Celsius, the growth is going to be more. If cold enriched at 4 degree, it is further going to grow. That is what you see with Listeria. So D ho gaya. What is going to be with E? With E, I have told you that you are going to do the diagnosis with the help of E for ELISA. And now let's come to the F and the G. So और क्या क्या कराएगा? So please note, diarrhea तो we have done, but this can also occur in females during pregnancy. And pregnancy में होगा मतलब this can result in neonate infection. And there is G से something known as granulomatous infanti septicum. You just need to know this big name because that is to do with Listeria. Granulomatous infanti septicum. Finally guys, if you ask me the treatment, तो A और G को combine कर देना, because you will get ampicillin and gentamicin as the treatment for Listeria. That wraps up. It's a beautiful mnemonic, all said and done. If someone asks you what is the toxin, of course Listeriolysin O. Once again, tully for tumbling motility, young age 25, not in old age 37. A for animal antin test. B for beta hemolysis. C for what all contacts? Contact, contaminated food, cheese. Okay, what will it cause? D for diarrhea. If it occurs in females during pregnancy, yes it can. In neonates it can cause what? Granulomatous infanti septicum. Okay, what are the tests that you will do? It is catalase positive, camp positive, and will show you cold enrichment. E for you can do ELISA. Treatment के लिए you will do ampicillin and gentamicin, and that is the overall Listeria monocytogenes that you have to know. The last organism that we have in this entire McDonald's mnemonic is going to be the Mycobacteria. So let's start off and finish off gram-positive organisms. What do I have in Mycobacterium TB? We all know that if someone asks you that it is Zn stain positive, means it is an acid-fast bacillus. The reason for the acid fastness is going to be a lipid called mycolic acid. Whereas if they ask you the reason for the virulence, that reason is going to be the cod factor. If they ask you what inhibits the phagolysosome formation in the body, once it enters into our body, what inhibits the phagolysosome formation? That is going to be lipoarabinomannan. Anything about lipoarabinomannan that you guys know? Is there any test that is done? Yes. LAM testing can be done in the urine. When would it be useful? It is very useful in patients who have HIV and TB. So HIV with TB mein, there is a test called LAM assay in the urine, lipoarabinomannan. Now I've told you what is the function of LAM. It inhibits phagolysosome formation. Okay, cod factor for the virulence, mycolic acid is for the acid fastness. So let's assume that the most common, or what should we assume? We already know the most common organ affected is the lungs, and the second most common, or other than the lungs, what is affected? You can say extrapulmonary. Kya hota hai? Extrapulmonary is lymph node. So let me start off with the lungs. Let me do all the different foci that are available, not only lungs but everywhere in the body. So please note, I've got a lung ka photo over here. If only lesion occurs in the lung, just lung, we are going to call it a Ghon focus. Ghon focus means focus, one lung, that is Ghon focus. If the lung and the lymph node is affected, if the lung and the lymph node is affected, now it's a complex. So now it will be known as the Ghon complex. So simple, sirf focus hai lung mein, to focus. If the lung and the hilar lymph node is affected, it becomes a complex, and in that complex, if a white kar dete, in that complex, if calcification occurs, now we are going to call it a Ranke's complex. So Ranke has K wala sound, so it's going to show you calcification. Are these three okay with everyone? Because now I move on to another picture of the lung and another three set of foci that I'll tell you. Please note, in this picture, what I'll do, I'll draw the clavicle ones, because that will tell me that the lung can be divided into supraclavicular region and infraclavicular region. We know that lung clavicle hota hai, so part of it is above, a part of it is below. So supraclavicular, infraclavicular, but at the same time the tip is always said at the apex. So please go from top to bottom. Sabse upar you have the apex, then this much of the area is supraclavicular and this much of the area is infraclavicular. Now you will write a mnemonic SPA in that order. which means that if someone asks you that what is it that you get right at the top, that is apex, S for Simon focus, S for Simon focus. Then what do you see? Next one is going to be supraclavicular. Supraclavicular pe kya hai? There is the People's focus. And infraclavicular kya hai? That is going to be Assman focus. So like I told you, please learn the mnemonic SPA from top to bottom. Apex, supra, infra, Simon, Pearl, Assman. Now we come to what do you call it in the liver? Liver is known as Simon focus. Please don't get confused. There is something called Simon which occurred in the lungs. There is something called Simon that has occurred in the liver, which is heavier, solid organ, heavier. Liver is solid organ, heavier. So heavy naam do usko. Simon becomes for liver and Simon becomes for lungs. Okay, blood vessel, v sound is what you will do. Blood vessel matlab V-girt focus. Okay, blood vessel matlab V-girt focus. And brain to rich people, of course, brainy people are very, very rich. So brain ke saath we have the Rick's focus. These are all the foci that you have for tuberculosis. So let's assume you had a case of pulmonary TB. What is the sample that you will take from the patient? Of course, you will be taking a sputum sample, but how do you concentrate it? You want that the TB bacteria should be visible. How do you concentrate it? Either you can use 4% NaOH, that is one method, that is the Petrov's method, but you can further modify it and you can use N-acetyl L-cysteine with 2% NaOH. That's another possibility that you have. What is NaLC? It is N-acetyl L-cysteine along with 2% NaOH is what you're going to modify. That is how you can concentrate a sample. It's a very, very famous previous year question. Once you've concentrated it, what is the first stain that you're going to do for TB? Of course, we are going to do the ZN staining protocol that we have, and I know from my general microbiology chapters that the organism is going to come out to be red and the background is going to come out to be blue. I'm not repeating the entire protocol, but you know there was a mnemonic called class has asked mnemonic. You know that, right? Okay, what is the sensitivity? You should have at least 10 to the power 4 acid-fast bacilli, matlab 1, 2, 3, 4. At least these many bacteria should be there. That's too much. So that is why I say that sensitivity is, 10 to the power 4, you need quite a lot of load for your stain to be able to pick it up, right? Now I want to ask you, this though everyone knows. What is the fluorescent stain that I had taught you? So please remember in your general we had studied for TB we have auramine and rhodamine, which are the fluorescent stains. Auramine, rhodamine, don't get confused, because if on the other hand instead of rhodamine I would have written rhodanine, the life would have changed because it is for copper. So remember, rhodamine is for Mycobacterium TB. Rhodamine, auramine, these are for M, Mycobacterium TB, whereas rhodanine becomes for copper. Okay, so now it is being said that this is actually the recommended method for screening. This is said to be the recommended screening method that you have over here. So please note on that as well. Okay, so microscopy all done. Now we come to the culture. What is the culture media? The Lowenstein-Jensen medium. What are the colonies? The colonies that you get on the Lowenstein-Jensen medium are going to be the rough, buff and tough colonies. These are the rough, buff and tough colonies which you get for Mycobacterium TB, but the problem is that it takes 6 to 8 weeks for this organism to grow. Oh my God, patient will have to wait for his report for 6 to 8 weeks, and at the same time, the sensitivity is better. There is 10 to 100 bacilli per ml of sputum. Guys, what was the sensitivity of microscopy ZN stain? 10 to the power 4. यहाँ पे 10 to the power 2 तक चला गया है, right? So definitely the sensitivity is better, but it's taking too much of time. Roughly 6 to 8 weeks it is taking for the growth. So I'll have to come for faster methods, which I'll come to. But they ask you what is the composition of Lowenstein-Jensen medium, and it's a proper English breakfast that you have to know. So firstly, in an English breakfast, you see eggs. So you have the coagulated hen's egg. On top of the eggs, I have sprinkled some salt. So next you have mineral salt solution. And along with that, you see a lot of green veggies. So green matlab there is malachite green, and veggies matlab asparagus. So instead of asparagus, I have written asparagine. Remember a proper English breakfast. Hen's egg with mineral salt, with malachite green, with asparagine, and malachite green is the one that has given it a background green color. So what kind of colonies did I tell you? Mycobacterium TB is going to show you the rough, buff, tough colonies, because now we have something called Mycobacterium bovis, which shows you the opposite. So tell me something. What is the opposite of rough? The opposite of rough is smooth. What is the opposite of tough? It is going to be breaking very easily. And buff, buff means cream, na? So cream ka opposite, bright white. So simple. If you've learned that TB is rough, buff, tough, then the smooth and the white and the easy breakage one becomes opposite, bovis. One more thing. Remember, TB is NNC positive. What is NNC? It is gonna show you niacin test positivity, nitrate test reduction positivity, catalase positivity, whereas bovis does not. So remember, TB is gonna be NNC positive and it is rough, buff, tough, right? Bovis is NNC negative and rough, buff, tough ka opposite. So LJ media is done for everyone, but it's taking a lot of time. So what are the newer methods that we have which can be done with the help of a machine? This machine is known as Bactec. What is this machine? So there are 3 machines that you have. They are all detecting TB, but their protocols and their principles are different. So there is something called Bactec MGIT. I'll give you the full form of MGIT because they can ask you in the paper. Mycobacterium Growth Indicator Tube. So what you're seeing over here in the bottom are the different indicator tubes that they have. You will say, ma'am, this will give me an indication, a hint that Mycobacterium has grown. And what is that hint going to be? In the form of fluorescence. So please remember, this is a fluorescent based method. And you will say that, okay, what is the culture media used? Isme LJ media use hota hai? No. There is a liquid culture media called Middlebrook 7H9 broth. Okay, so it's actually filled with a liquid. This is actually filled with a liquid like this. And in this, you are going to grow mycobacteria. When the mycobacterium will be grown, kya indication aayega? Fluorescent indication, shining indication aayega. I will get to know mycobacteria has grown. That is the indication that I get with Bactec MGIT. What is with Bacti alert? How am I going to get the alert? It is going to be by color change. Alert by color change. It is colorimetry based. Finally, we come to Versa Trek. Trekking pe jaane ke liye you have to apply a lot of pressure and stamina. So Versa Trek is going to be a pressure change detection method. So simple. Bactec MGIT, that is fluorescent. Bactec alert is going to be color based, and Versa Trek mein pressure lagega, that is pressure based. These are the newer methods. What about molecular studies? Yes. Can you do RFLP? This is the next set of 3 things. How am I going to do the typing, or in simpler words, how am I going to do the molecular studies? Can I do RFLP, restriction fragment length polymorphism? Yes, but you will have to. This is the question that they've asked you in the previous year. TB ka kaun sa wala strain use hota hai? So it is the IS6110 strain that is used. Very, very, very important, simple ratta question, IS6110 strain for RFLP. But nowadays, the question that you'll get will be on Gene Expert, and that is the picture of a Gene Expert that they have put up. So, kya hota hai? Can you all see one bar-coded cartridge which is going inside? So, this is a kind of a CBNAT. What is CBNAT? I think we all know. CBNAT stands for a cartridge-based, and NAT, of course, you know, nucleic acid amplification testing. PCR ka hi chota version hai na? Nucleic acid amplification testing. Please note that this is going to have a turnaround time of 2 hours. Turnaround time means you gave the sample and you got the report. Kitni der mein? 2 hours mein. You gave the sample and within 2 hours you will get the report. So it's a very quick test. Remember, those LJ media and all were taking 6 to 8 weeks. This is getting me the result in 2 hours. What are the other advantages? What is the sensitivity? Or if someone asks you what is the detection limit of Gene Expert that you have, and that is 131 organisms present per ml of the sample. 131 organisms present per ml of the sample. This has one more advantage. Let me write down all the advantages. The advantage is that not only can it help in diagnosis, plus it can also help in knowing the resistance. Like for example, if you want to find out, let me write something, RPOB gene. Kaun sa resistance am I trying to find out? Rifampicin. If you want to find out the rifampicin resistance, you can definitely do Gene Expert. So Gene Expert is needed not only for diagnosis but also for knowing the resistance. And lastly, we have something called line probe assay. So these are all the molecular methods that you have, but these are for TB. There are 2 tests which you do for latent TB. And what is the 2 tests that we have? 2 tests that we do for latent TB are definitely going to be the Montu's test, and second one is going to be IGRA. So let me start with Montu MON2s, which I think everyone knows is the tuberculin test, where 0.1 ml of purified protein derivative is given intradermally. 0.1 ml of purified protein derivative is given intradermally, and you are going to read after 48 to 72 hours. After 48 to 72 hours, what are you going to check out? You will only read the hardening, the thickening, the induration. Only read induration. Don't start reading the redness and the local site inflammation. No, only look at the thickened area. When you get a positive, what is positive? So you will say that, ma'am, if I get above 10 mm ka induration, it is positive MON2s. If I get less than 5 mm ka induration, it is negative MON2s. And anything between 5 to 9 mm is going to be equivocal. I will have to do a repeat, or I will then have to get a chest x-ray and further studies, right? Less than 5 negative, more than 10 positive, in between it is question mark. So what is a positive test? Let's say it's come more than 10 mm, positive test indicates some infection. Could be a present infection, could be a past infection, some infection. Okay, can you get a false positive? Yes, what if someone had been infected not with TB but some other mycobacteria, some atypical TB? बिल्कुल तब हो सकता है if someone is affected with some atypical non-TB wala mycobacteria. Also BCG vaccination, yes, BCG vaccinated people can also give false positive MON2s. When do you get false negative? Now please note, MON2s is what? It is a type 4 hypersensitivity reaction, means cell-mediated immunity, which means that if someone can't have cell-mediated immunity, that person will not, even after having TB, he has been infected with TB, but he doesn't have any cell-mediated immunity, he will never show this MON2s positive. So can I say, in a case of HIV or any kind of immunodeficiency, because the person does not have any cell-mediated immunity, he will not show you any response to MON2s, right? So these are the points about MON2s that they're definitely going to ask you, but this was just one of the tests that you have for latent TB. The second one is personally the examiner's favorite, and that is known as IGRA. If you read it, interferon gamma release assay. Interferon gamma release assay, because I know that interferon gamma is the one that is needed for G, granuloma formation. Granuloma matlab TB. TB mein I know interferon gamma release hota hai, ma'am. This much I know from my general immunology lectures, yes. So what will I do? I will take the T lymphocytes of a patient whom I feel has TB. Suspected TB case hai, uska kya liya? T lymphocyte matlab simple blood sample, kuch bhi bada test nahi hai. Simple blood sample liya, you take the T lymphocytes, because I know T lymphocytes are the ones that release interferon gamma. So I take T lymphocytes and I expose them to in my lab, I expose them to the TB wala antigens. What are the TB wala antigens that you have? You have 6, 7 and 10. ESAT 6, TB 7.7 and CFP 10. 6, 7 and 10. Repeating, ESAT 6, TB 7.7 and CFP 10. What will, for example, this person has TB. What will the T lymphocytes release? The T lymphocytes will release interferon gamma. How will you measure it with? It is going to be measured by ELISA. So please note, this is the interferon gamma release assay which you can do for the diagnosis of latent TB. That marks the end of TB, like proper mycobacteria TB. But now what I go on to are the non-tuberculous mycobacteria, which we also call as atypical mycobacteria. Please note, there is a very famous and a tough classification for them on which you get a question, and that is the Runyon's classification. That says that the non-tuberculous mycobacteria are of 4 types. Photochromogens. Photo means light, chromo means color. So they are going to produce a pigment. Definitely they produce a pigment, but in photo means only in light. That is why photo mein produce karenge, light mein. Scoto means dark. So they will also produce a pigment in dark and light. Both situations they are going to produce a pigment. Non-photochromogens just means there is no pigment production, no pigment at all. And rapid growers means the ones which are going to grow within 1 week. The ones which grow within 1 week or 7 days are rapid growers, right? So one by one, let's do their examples. This is the Runyon's classification. So starting with photochromogens. Did I say pigment production is going to occur in the light? And remember, agar photo khichana hai, photo ke liye, ma'am, I have to put a lot of filters now. It's like on Snap and Insta, we have to put a lot of filters. So can you see there is this girl named Simran and how she has just transformed her face by putting some mask or some filters? Yes. So there is a girl named named Simran who has put a lot of mask, that is MASK, mask lagaya for photo. तो photochromogens के लिए mask, that is Marinum, Asiaticum, Simiae, that is why I named her Simran, because S is going to have a lot of mycobacteria. You should know which S comes over here. Simran wala, Simiae S comes over here, and Kansasi. Marinum, Asiaticum, Simiae, Kansasi. Now please note, marinum anyway sounds like marine and water. This causes swimming pool of fish tank granuloma. तो कुछ marine water आया ना, तो swimming pool of fish tank granuloma, which is nothing but lots of warts which are there on the skin. So photochromogens are done. Now let's go on to the scotochromogens. So where is the pigment production going to occur? Pigment production will occur not only in the dark but also in the light. And how we have learned the organisms is that dark ki baat ho rahi hai. Okay, God save me from the dark. God save me from the dark. So dark matlab you will think of scotochromogen. And then we will think of God, so that is going to be Mycobacterium gordone. And save se kya aayega? We have Scrofulatium and Sulgi. So will you put Simiae over here? Nahi, Simiae was that photo khichane ke liye Simran was there. Now over here you will have Sulgi and Scrofulatium, and gordone is what you will have. I hope you remember God has given us natural water all around. Matlab gordone is a tap water scotochromogen. God has given us water all around, so it is a tap water scotochromogen. Okay, now everything else comes under non-photochromogens. Baki no mnemonic needed. Mycobacterium, avium, intracellular, ulcerin, xenopy. If you get a question which out of these is gonna cause Burulese ulcer, there's no doubt about it. Mycobacterium ulcerans is gonna cause Burulese ulcer. I hope you remember that this is the only one to produce an exotoxin. What is that exotoxin known as? That is known as mycolactone. If you remember, we had studied this in our main videos. The only one to produce the mycolactone exotoxin is the Burulese ulcer wala Mycobacterium ulcerans. Now tell me, Mycobacterium avium and intracellular, are they together known as Mycobacterium avium complex? And do you remember a story of a Victorian play called Lady Windermere syndrome? Lady Windermere syndrome was a female who never used to cough. Victorian female, very sophisticated. She never used to cough. So Sara secretions were in her lungs. And then she got infected with Mycobacterium avium complex. So MAC is associated. How we had learned it was, MAC is a very, very famous makeup brand. So makeup wala jo brand hai, wo lady wale syndromes mein hoga. Lady Windermere syndrome was associated with makeup brand, Victorian sophisticated makeup lady. So that is going to be MAC. Also, there's one more organism that comes under it, the same non-photochromogens known as Mycobacterium indicus prani. What is this Mycobacterium indicus prani? So if you realize, it is indicus prani, lots of eyes. This is an immunomodulator. Why am I using this immunomodulator? This has now been used for making a leprosy vaccine. एक MW vaccine है for leprosy. This is an MW vaccine for leprosy, and that is where you are using this strain. So remember, Mycobacterium indicus prani is going to be an immunomodulator. This indicus prani is an immunomodulator, and it is used for making a vaccine for leprosy. अब क्या बचा? Now the rapid growers are left. Who are the rapid growers, guys? The rapid growers are the ones which grow within 7 days. Who are the people who become successful overnight? They are the people who are going to either be very, very fortunate, or they are very smart, chalu people, ma'am. They are very, very smart, or they are very, very chalu. Chalu means clever for those who don't know Hindi. Or they are just the people who have a camera and they are just becoming viral for no reason. Matlab free, vela kind of people. So what do I mean? Who are the rapid growers? Fortunate, fortuitum. Smart, smegmatis. Chalu, chelone. And just free vela people, so flea. Fortuitum, spegmatis, chelone and flea are the ones who will grow overnight, that is within 7 days. And I hope you remember, there is a very famous question that comes with Mycobacterium chelone, that is a post-surgery abscess. It is associated with post-surgery abscess. That means that they will say that there is a person who underwent a hip replacement or a knee replacement, and after that, an infection occurred, and that infection was growing very rapidly on the culture media. Within 7 days, it was growing. So always think of chelone out there. Yes. So Mycobacterium tubercle wala bhi ho gaya. The last one, if I show you, you can look at just two pictures. You have to know what is this Mycobacteria leprae. Now the good news is that I don't have to tell you any culture media for Mycobacterium leprae. This is an obligate intracellular organism, so it cannot be grown. It cannot be grown on any culture media. How will I grow it? Look at this organism. Look at this animal. 9 bands he has, if you have time to count. So it is grown on a 9-banded armadillo. It can be grown on a 9-banded armadillo, or it can also be grown on the footpad of mice. Basically, I will need some animal because this has to grow within the cells. So I cannot have any blood agar, chocolate agar. I will need cells. I will need animals for it to grow. And that is Mycobacterium leprae or the Hansen's bacillus. I have taught you leprae in a lot more detail in main videos. Why am I not covering it in the RR is because I believe leprae is like such a huge topic that you have done in dermatology. So I don't want things to be repetitive. Yes, on that note, this is the last part that you have, not only for gram for mycobacteria, but also all the gram-positive bacilli are done. After this, I'll be going on to the gram-negative family. I'll start off with Enterobacteriaceae.